guys. There we go. This game is controlled with the nunchuck style. Alright. That means I must have my nunchuck ready to go. Check. Oh, listen to that great hospital music. Reset the clock and start the clock. Get into it. New game. Definitely easy because I don't know what I'm getting into yet. Hope Hospital. Episode prologue. This is Hope Hospital, located in downtown Angeles Bay. Since its interception, Hope has selfishly served the community. One of the newest doctors here is still in need of guidance, but he strives to improve out of an earnest desire to help people. Dr. Derek Stills will soon come to realize his full potential. Okay. New episode available. Standard procedure. You may now continue the story. You can also select your difficulty mode with the Z or C buttons. Yes, I want to start. Episode 1. Hope Hospital consultation. Patient has moved to pre-op area. Okay. Mary Fulton, age 39, Hope Hospital's veterinarian surgical assistant. She's kind and well-liked, so nobody mentions she tends to ramble too much. The injury is located on his forearm, and he is fully conscious. We should be receiving blood test results from the lab any minute now. It looks worse than it is. He's not in any real danger. You might say he got lucky. Dr. Greg Castle, the head of Hope Hospital Surgical Department. He's not easily rattled, but he is strict and expects perfection from his assignment. Can't even pronounce that word. You'll be operating, Derek. I will. There we are, Derek Stills, at age 26 and an inexperienced surgeon, and the story of this main character. He's just completed his residency and accepted a position at Hope Hospital. Alright. I was just about to, so. Worry about that later. You're not an intern anymore. Hurry up and prep for the OR. This is a simple extraction procedure. There's nothing to worry about. Just take your time, stay calm, and keep steady. You should be able to handle this on your own by now. Alright. Lacerations and foreign object in the upper right brachial. Requires removal of the foreign objects and stirring any wounds. Sterilizing any wounds. Let's begin the briefing. Our patient, Kevin Trunk, just arrived in an ambulance. He lost control of his motorcycle and crashed through a glass door. Ouch. He received a number of lacerations which have began to hemorrhage. There are glass fragments lodged here in his right forearm. Our cosmetic surgeon is out at a medical society meeting, but you should be able to handle the stitching. It's fairly straightforward. There are two main objections in this operation. Suture any lacerations and extract fragments of glass from underneath the patient's skin. Be thorough and try your best not to leave any scars. Alright, we're going to begin the first operation of the night. Let's go. Patient's life is in our hands.
Let's begin.
Let's begin. We should start with those lacerations. Take the stitching needle to suture these
Suture
wounds.
in a zigzag pattern.
I left a scar.
Doctor?
Now do the same thing with the other lacerations.
You did very well.
Well done. The lacerations have been taken care of. Next, we'll take the
Mindful
forceps.
of the direction.
Rip the glass. Once you have a hold of it, slide it out. Don't grab it. How do you grab it? This patient's gonna die. We can't grab it. Slide it out. I'm just trying to figure out how to use the tools. That's to select it. I'm pointing right at the... Huh. Once you have a hold of it, slide it out. See, I don't have a hold of it. Huh. Thing broke? What is going on? Trying all these different buttons. What is going on? Why won't you grab it? I'll just retry it. I'm just gonna retry and see if maybe I missed something. I was running out of time.
Starting the operation.
Starting the operation, yes.
Let's begin. Suture in a zigzag pattern.
Next, take the forceps. Once you have hold of it, slide it out. Yeah. But it won't let me pick it up. That's what I'm saying. How did I pick it up that time? Oh, okay. I see. Oops. Whoops. Killing our patient.
That's good.
There we go.
Amazing, isn't it?
In the past, cure all ornaments were just gimmicks and scams, but someday we'll finally create a real one. Oops, I shouldn't be talking so much. Let's continue. Some glass shards are embedded in the patient's arm as well. We'll need to extract those. Make an incision in his upper. But don't forget to disinfect the forearm with antibiotic.
Let's move on.
Okay.
Remember to be careful. Stay calm.
Oh my god. I can't. There we go.
Dr. Styles,
We'll need to get to work quickly. Yes, I know.
treatment complete.
Alright, everything looks good. Let's close up.
Dr. Styles,
So suture the wound the same way you did before.
let's
He's
move
definitely
on.
gonna have some scars from me. I'm scarring him up. Disinfect the sutured wound. Okay.
That's good.
That should heal up nicely. Now we should just apply a bandage. There are some tools you only need to use a specific instance. You can pick them up once you have placed them on the tray. Bandage along the area.
Good job, Dr. Styles.
Make sure you review what we went over today and when you have the chance. Okay. Operation successful! Got our first operation down. Yes. Oh, I got a C ranking. I'm not a good doctor at all. Don't come to me if you need sutures. See, you're catching on quickly. That wasn't so hard, was it? I couldn't have done it without my lovely assistant. I can definitely see improvement, but flirting isn't everything. Seriously though, keep practicing and you'll do just fine. Okay. Ooh, I'm not the doctor to come see. I gotta see. Now saving. Learning the ropes. This is a really interesting game so far. Judging from the MRI, the tumor is isolated in his stomach. It's benign. Should know this word.
Benign.
Benign, but you should be prepared for anything. Any questions, Dr. Stills? Huh? Oh, yeah, I'm fine. Thanks anyway. Are you even listening? I know you're stressed, but this just so happens to be your job. Are you getting enough sleep? You need at least 6 hours a night. I'm sure they went over that in med school. These patients are depending on you. Derek, don't forget our follow-up appointment with Mr. Jenkins this afternoon. Have you read the report? I haven't, actually. You need to shape up. This is real life. We aren't playing games. You've been here 3 years, Derek. We shouldn't still have to babysit you. This might be grounds to open an investigation. The impaired medical and social development of Dr. Styles. Harsh, cut me some slack, Mary. You're not a resident doctor anymore, Styles. You know that. By the way, Mary, I spoke with Dr. Hoffman. Thank you very much. Wait, you spoke with the director about what? Don't worry, it's none of your business. It's a personal matter. Forget I ever mentioned it. Are you going on vacation or something? I wouldn't mind a nice long cruise myself, lounging in the sun, the sea stretching. Okay, that's enough. We have an operation to perform. Tumor confirmed at the surface of the stomach. It should be removed before it becomes malignant. Today we need to exercise a tumor in the patient's stomach. 2 years ago, tests indicated that it was small and benign. However, it's grown rapidly and started to hemorrhage. At this rate, it might become malignant. After talking with Mr. Lorry, we've decided to remove it. There's one objective in this operation. Exercise and remove the tumor in the patient's distal stomach. That is all.
Miley.
But you'll need to remove the tumor using your Powell procedure. First, drain the tumor to decrease its size. Then, once to exercise, the cells can't metabolize, resulting in smaller incision. There seems to be a trend towards this type of removal. It's a good idea for you to learn it. Now begin the operation. Stay calm and keep steady. Understood. Let's begin. Let's go. Operating.
Let's begin.
This will be you'll need to open up this abdomen. You've done this before, so there's no reason to be. Let's begin to disinfect. Yep. I was gonna say we need to disinfect the area. Then we need this. And not cut a straight line.
So you can't cut a straight line for nothing.
We're going to treat a tumor, but his vitals are dropping. You'll need a syringe. Let's stabilize his condition. Insert it into the vial first to fill with medicine.
That's good.
Now inject it in the affected area to make sure it holds steady. Vitals are stabilized. Now we can begin. At first glance, it appears that nothing is wrong. However, yesterday's test revealed something in the patient's lower stomach. We'll need to use an ultrasound in order to find the problem area. You can activate the ultrasound pressing the B. You will notice the infected areas show up as shadows on the sonar. Said the lower.
Doctor?
Found it. We lost sight of it because the ultrasound was too far away. You could scan directly over the tumor. It should remain visible for much longer. Expert doctors can perform this operation without the benefit of visual aid, but you should take this as to confirm.
Let's move on.
That's definitely a problem. Now we'll have to expose the... Oh god. We got a cut?
Styles.
It's pretty big. It looks like we did this just in time. As Dr. explained earlier, we'll use the Powell procedure. We'll need to drain it.
Keep it steady. That's good.
Okay. We'll continue to ooze out if we don't do anything. Oh god. Oh god. We're gonna cut around this.
You did very well.
Okay. Now we gotta extract it.
That's good.
Okay, now we gotta disinfect it. Grab the membrane with the forceps. Grab the membrane with the forceps. Okay, I'm trying. What's the forceps?
It'll be over on that tray thing.
Oh.
Dr. Styles.
That's good. Now let's fix this. First apply antibiotic gel to disinfect it. Okay.
Treatment complete.
That's enough gel. The membrane is beginning to meld with the tissue. It's made of protein, so there's no chance of tissue. I really need to give it. We're losing him. Better hurry up. We're losing him. Our patient. Now finish the operation. Oh. There it goes.
Good job, Dr. Styles.
We did it! Yay! Another successful. Watch it be a C. Because I told you I'm not the doctor. Told you. I'm a C ranking doctor. So you need anything done on a budget, I'm your guy. You really took your time and did things right. Just remember the patient's safety always comes first. You're getting better every day. Keep up the good work. It's gonna be interesting when when I'm left alone. Farewell, Operation Rank. A farewell operation. A farewell. Hope Hospital Nurse Station. And so, since my husband's been relocated to a different office, I'll be leaving Hope Hospital effective immediately. I'm really going to miss this place and all the friends I made here, but I promise to continue my work as a nurse, whatever life takes me. You all taught me that nothing is more important than satisfying the helping patients. It was a pleasure to have you on staff, Mary. Good luck with the new job. I can't believe you're leaving. This is all so sudden. How are you going to get by without her, Derek? Actually, Derek's the one reason I was a little hesitant to leave. I even spoke with my husband about it. I told him there was a kid here who depends on me. He asked how long I'd been working in pediatrics. Ha 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 ha. Ah, come on. I'm not that bad. Thanks, Dr. Funks. He says I'll be an excellent surgeon.
I may have to disagree with you there.
Is Nurse Fulton still here? Oh, hello, Dr. Hoffman. I'm not interrupting anything, am I?
What?
Robert Hoffman, age 62, the director and founder of Hope Hospital. He used to be a renowned surgeon, but then retired to work in management. No, of course not. I came to say goodbye since I won't be around tomorrow. Thank you for your many years of dedicated service. You're a fantastic nurse, probably our best. On behalf of our entire staff, I'd like to say thank you. As long as you don't cut into me, we won't. Yeah, we won't have any problems, will we? The only patients I'll be working on is the ones that are trying to get away from the law. Oh, sir, the pleasure was all mine. I wish there was some way I could thank you for the opportunity. Well, you're not going to stop nursing, are you?
I figure I'd respond to him on my own without going through that.
If you continue to help people, that will be thanks enough.
Hey, at least I'm interacting.
Yeah, of course, sir. Helping people is my life. It's just, I wish I could stay and learn from you a little longer. Don't be modest. You already know everything I could teach you. I'm afraid Dr. Castle suppressed me as a surgeon long ago. Dr. Hoffman, good luck with your new job. Don't be a stranger, alright? God, how much dialogue is in this thing? At any rate, I have other matters to attend to, if you'll excuse me. I wish I could have seen Dr. Hoffman in action more often. But he hasn't performed any operations since that incident. Derek, let's discuss the new patient. Yes, sir. This will be my last procedure at Hope. Don't let me down, Derek. Oh, I'll let you down, trust me. Multiple tumors confirmed in the pancreas. They may lead to a loss of stamina, so immediate removal is highly recommended. Yesterday's procedure went very smoothly. See, I've beaten 6 Wii games. Yesterday's procedure went very smoothly. I want you to handle Mr. Spence's operation today. It's another tumor extraction. Just be careful. There's more than one this time. Make sure you don't miss any. Yeah, I was gonna say 5. Counter says 6, don't it? I'm working on game 7. If you can handle this operation, I'll feel much better about leaving. No, I'm on 7. The way I count is when it's complete. I don't count it as I'm doing it. If you can handle this operation, I'll feel much better about leaving. Oh, I didn't mean to upset you. But wake up, Dr. Stills. The only person you should be thinking about during an operation is this patient. Do you understand? Yes, ma'am. Let's review the main objective of today's operation. Exercise and remove all tumors. Now think about yesterday's procedures as begin. Here goes. Let's begin the operation.
Let's begin.
Alright. Let's begin the operation. So we need this. And we need this.
See? Not a straight line.
That wasn't straight. I know.
I said not a straight line.
Oh, well, we're gonna get rid of the inflammation. Whoa. Alright. What's the inflamed area? Let's grab the... It's kept in the blue vial. Inject that into the inflamed area. What's an inflamed area? Oh.
Let's move on.
Good, the swelling's going down. Let's move on to the tumors. Yeah, real good skills. There's 3 turnovers. Oh god, here we go. We got it. Oh, we found one. Found one. Now we gotta cut it. And then what was it we did? Oh, we sucked it. We gotta suck it. There we go. Then we gotta cut it.
Just 2 more.
Where's the needle? I need the needle. There we go. Patient's healthy again. Alright, now we gotta suck it. Cut it.
One more left.
And then we got the last one to do. I'm a natural, okay. What you guys are talking about? All natural right here. Yeah, I missed my calling. Okay. He's about to die, so I better inject him with this stuff. One more. There we go. I need to put the... That's pretty good with the scalpel. That's 2 down. What's wrong with this one? Did I not finish the cut on that one? There's nothing coming out of them. That's pretty good with the scalpel. That's 2 down. What's going on? I'm confused on what I'm supposed to do. She's saying one of them isn't cut.
Are you supposed to maybe pull them out now if you...
Oh yeah, we gotta take the tumors out. That's right.
You did very well.
God, we gotta take the tumors out. Oh yeah, I couldn't even remember how to do my job.
Dr. Styles. See? It's simple.
That takes care of the tumors we found in our test. You're really improving, you can tell. You seem really focused today. I guess my work here is done. Now we need the sewing, which was this one. Bad! They gave me a bad rating on that one.
You need to hurry.
Whoop.
Well done.
There we go. Woohoo! We got through it. Operation successful. And they didn't walk me through it. Miss Chosen did though. Ugh. You did great job, Derek. It looks like I have nothing to worry about. You're going to make an excellent surgeon. Yeah, okay. Please continue using your abilities to help the people of Angels Bay. Oh, here comes the new nurse. Watch, she's not as supportive. She's gonna be the mean one. And so we all felt you deserve a special gift of appreciation. Thank you for 18 years of dedicated service, Miss Fulton. I don't really know what to say. I'm a little embarrassed. Miss Fulton was more than a great nurse. She looked after us all well. She will be missed. Are you sure you're not glad to be free of my nagging? What are you talking about? I'm just worried Derek's going to start coming to work late again. You're the one who kept him in line, Mary. Ah, geez, I'm standing right here, guys. You don't need to worry. I'll be fine without Mary's help. I may be young, but I'm still a doctor. That's good to hear. So no more sobbing phone calls from you, huh? What? I wasn't crying. I'm just teasing, Derek. You're grown up so much since I joined us, and I'm proud of you. Work hard and you'll suppress even Dr. Castle one day. Don't forget that I believe in you. She isn't here yet. Is something wrong? We must be talking about my replacement. Since I'm leaving, you're going to need a new assistant. I was supposed to train her this afternoon, but HR assured me she's very reliable. I hope everything's okay. Sorry I'm late. Oh, she's prettier than the other one. I'm Angie Thompson, the new nurse. I'll be starting here tomorrow. It's very nice to meet you. Wow, she's a nurse? Isn't she a little too... What's that now? No, nothing, pardon me. On the way here, I saw a man get hit by a car as he was crossing the street. I took him to the nearby clinic and stayed until he transferred him to St. Francis Hospital. Of course, the paperwork took forever to fill out, so yeah. Sounds like you had a rough morning. Well, don't you worry about being late. I completely understand. Excuse me, has Miss Thompson arrived yet? There's someone on the line from St. Francis Hospital. This must be about the patient. Please excuse me. Certainly is something else. Looks like I'm leaving in capable hands. What do you think, Derek? Hi, Chihuahua. I think is what he's thinking. Singing the blues. Good morning. Hello, Dr. Stills. You were supposed to be here 15 minutes ago. Your patients should have to wait just because you're behind schedule. I'm sorry? Anyway, I'll call you the first one. Man, she's strict. Please have a seat, Mr. Cox. Yo, Doc. During today's surgery, I will be removing a polyp from your throat. How are you feeling? It's important for us to know about any changes to your condition. There could be problems if anything unexpected happens. I don't know. Fine, I guess. I really don't know. Huh? It's just not fair, you know. I spent years working part-time trying to keep the dream alive. Now we finally land a contract with a big-time record. And my throat's all screwed up, so what if something goes wrong? I'm wasting my life. I have to work retail till I die because of this stupid polyp thing. Just to relax, we're hoping you're for the best. Yeah, I'm hoping, huh? That's clearly all it takes, right? Hope, not practice, not discipline. If you could get by on hope, I would have been had a record years ago. Maybe Dad was right. I was stupid to think I could be a rock star. Come on, try to stay positive. You're gonna be fine, really. Sorry, Dex, Nate, Tish. You guys fronted the money and I just ended up letting you down. I don't even know I'll be able to pay it back. I need to take your blood pressure, Mr. Cox. This way, please. Yeah, whatever. Why didn't you just tell him everything would be fine? Wait, what? Don't you even read your own notes? You knew he was nervous about this. Our job is about more than just treating illness. Proper bedside manner is an essential element in a patient's recovery. Things you say directly affect those people's attitudes. Don't you get it? Yeah, I do. I hope you handle things more appropriately during surgery this afternoon. Polyp clusters confirmed in the trachea due to an internal hemorrhaging. A hemostatic laser procedure is necessary. We should start the briefing. Let's review today's patient, Mr. Cox. He started feeling pain in his throat about a month ago. He's been coughing up blood since, and now has trouble breathing. Since Mr. Cox is a rock singer, it's likely a polyp that has developed due to strain. Bronchial tubes. Obviously, it started to hemorrhage. We attempted to treat it with a nebulizer, but his condition keeps getting worse. It's nothing life-threatening, but considering the patient's career, it's serious enough to warrant surgical intervention. It is possible for him to fully recover. What's your opinion, Dr. Kessel? That sounds like a good plan. Are you ready, Dr. Stale? The operation has 3 objectives: drain the overflowing blood, locate the source of the patient's distress, and use the laser to remove it. This is a delicate operation, so we'll need to use the magnification tool. Remember, this is the patient's livelihood, so tread carefully. Nice work, Angie. Derek, good luck. Just maybe. Just maybe. The patient's in my hands again. Oh no, how are we gonna handle this?
Dr. Styles.
Hey, I'm getting straighter.
Dr. Styles.
Outer membrane of the trachea has started to hemorrhage. That should be our focal point. It's hard to see the affected area, so we'll need to magnify it. Take the magnification tool.
Use the magnification.
I'm looking for it. That's sonar. Where is the magnification tool? That's the laser. Oh.
There.
That's it. The hemorrhage is our problem. Once you finish working in the infected area, simply return to the non-magnified view. Keep this options in mind as you set up the best angle for a given task. First, we need to drain the blood so those polyps don't explode. So that would be a drainage. There's no way we can exercise them. They're too small. Use the laser.
Dr. Styles.
The laser will continue to burn its tissue as long as it's activated. Applying it for extended periods will cause additional bleeding. Please be careful only to apply the laser precisely where necessary.
Dr. Styles.
Will you get off? What do you want? Further bleeding. You're going to need to adjust this procedure accordingly. We need to apply antibiotic gel immediately after using the laser. The blood starts to collect. Drain it quickly to maintain visibility.
Dr. Styles.
Getting worse. You even have more bleeding. Drain the blood. Doesn't look like a neck. Well, that's what they're calling it. He keeps bleeding. Drain the blood before continuing or won't be able to see. There we go. It could have gone better. It looks like there are several other polyp affected areas. We'll need to treat them all. What?
That's what I read. What Dr. Funk said. But it doesn't look like a neck.
Yeah, I know. And he's bleeding up here. There we go. Please continue the treatment. Blood. Laser. There we go. God. These things just keep popping up everywhere. Oh, he's about dead. I better pay attention to his life more than I'm paying attention to his sores. About killed the patient.
Treatment complete. Almost done. Good work, Doctor.
So I've been really assigned to this inexperienced slacker. That is good job, Dr. Styles. Oh, she's calling me a slacker. I'm no slacker, you the slacker. Well, Mr. Cox, your operation was completely success. Don't try to speak yet. Your throat needs to rest for a few days. No worries though. A week from now, you'll be bleeding out power ballads good as new. Speaking of which, how about a couple of tickets to your next concert? Hee. A real doctor. You got the wrong person. Thank you so much, Doctor. Take care now. Well, it looks like our last walk-in for the day. Angie, let's start our pre-op at around 1 o'clock, okay? Don't you think we should have examined him more carefully? There were signs of conitis, which could indicate asthma. If that's the case, he needs to see his physician right away. Really? I didn't think it looked like anything serious. You need to start acting like a real doctor, Mr. Styles. You are overacting. I'm sure he'll be fine. Multiple tumors confirmed in the small intestine, resulting in several other inflammation. Immediate removal is required. Since Dr. Kessel is at a conference, I'll be briefing you today. I think you'd be briefing me even if he was here. We're extracting a stage 1 tumor from the patient's small intestine. So if we take it out, you should fully recover. However, his blood test results were unusual. We can ask Dr. Kessel about that once he gets back. As long as they extract the tumor, the patient should be fine. That's technically correct, but I'm pretty confident about this. I've extracted tumors several times already. This'll be a snap. Okay. Keep up the 2 operation objectives in mind then. Treat the inflamed in his small intestine and exercise and remove all the tumors in the area. If you're ready, let's begin. Let's operate. Alright, The patient's life is in your hands. Yes,
Let's begin.
sir. So what we gotta do is disinfect. And we cut. And then, oof. What's going on? The entire intestinal membrane is inflamed. What's going on? Only specimen. I think we need a close-up of the patients for re-examination. Let's continue operating. These symptoms aren't uncommon. I understand. In that case, proceed with the tumor extraction. Okay. Now I gotta remember what I gotta do. Was it this? No. Oh, it was the blue. That's right.
Proceed as normal.
Yeah, I remembered how to do this. No worries.
I want to keep an eye on the heart rate. Or you're gonna kill your patient.
Oh, he'll be fine. His heart rate can go down to 90 to 10. He'll be alright. We got a morgue, don't we? Oh, I'm out of juice. Treatment of the visibility inflamed areas is complete. So now we need the magnification. And we need the sucky suck. That's not the sucky suck. That's the sucky suck. Give him 2 shots, and we should be go to go. And then we gotta find some more. Make sure we get them all highlighted and ready to go. So I know where I'm going. Okay, we're doing alright.
Proceed as normal. Dr. Stiles?
You let it re-parameter. Rookie mistake. I don't know what you're talking about. We're fine. Oh, I see what you're saying. I got you. I'll give him a couple shots. 1 shot will work. And we need the sucky suck. We need the forceps.
Dr. Stiles? We got it.
We got it! See, we had this. His vitals aren't stabilizing. There must be something else. Patient's vitals don't usually stay. Okay. What would you suggest? Try using the ultrasound again to be safe. Just to be safe.
Doctor?
I'm working on checking it. I don't see anything, Angie. But I was certain. Sorry about that. Second guessing you, Doc. Don't worry. We're both still learning from experience, right? I guess.
There. Not much time left. Good work, Doctor.
Good. Finished. Yay! Operation successful!
Let's see if you get more than a C. Doubtful.
Doubtful. I am a C doctor, see? I am your C doctor. Dr. Styles. Oh, hey, Angie. Well, thanks for the help in here. Barely surviving because I'm a C doctor, Retro. How you doing? Thanks for the help in there. I'd like to have a word with you about the last operation. Well, there's something wrong with my bedside manner. No, it's about the patient, actually. His white blood cell and gluten counts are rising rapidly. I also noticed inflammation along the patient's bedroom. We should re-examine him immediately and consult his regular doctor. I agree with you, but I'm afraid it will just have to wait till tomorrow. I'm supposed to help with the next, so I'm meeting with someone. Doctors from St. Francis to learn the ropes and everything. But they traveled a long way to meet with me. I can't just blow them off. We'll handle this first thing tomorrow, I promise. But well, at least they didn't die. You might get sued though. Yeah, that's true.
If it wasn't
Too
for
bad
this
too bad we have to
patient
work
would've
tomorrow.
died.
I would have liked to talk a bit longer. Oh well, at least now I'm ready for a thing. Oh, my cell phone. Derek, where are you? The patient is in critical condition. Get back here right now. What? Taxi, take me to Hope Hospital and step on it. What's wrong with our patient? Angie? A tumor metastasized behind his lungs, which then began swelling. It continued to fester until 30 minutes ago when the tumor ruptured. The patient is in shock and suffering acute peritonitis. The other doctors are operating on him as we speak. Follow me, Mr. Styles. You need to see the consequences of your carelessness.
Downpour.
My career's in the toilet. Yay! I understand you didn't have much information to base a decision on, and I do admit the tumor was difficult to see from the x-ray. However, the laboratory left you several memos about the patient. I understand they pointed out this extremely high readings. More than that, you dumped your responsibilities onto our nurse immediately, following your very delicate operation. It wasn't, I mean... Mr. Thompson, Miss Thompson, what are you? Please excuse me for interrupting Dr. Hoffman. I understand this is a little rude, but I have to say something. What is it? It's about the neglect attitude about Mr. Styles has displayed thus far. I warned him about the patient at least 3 times, but he said there were important personal matters he had to take care of. Then he just walked out without another word. Mr. Styles, maybe you didn't harm the patient directly, but how can I work under a doctor who doesn't even try to act like one? Doesn't matter how small or groundless a suspicion might be. Yep. Sure, I'm getting ripped a new one. The patients are depending on you. Take care of them. Why did you even become a doctor? Do you even know? You don't deserve to be here. You're not a real doctor.
Mamas. Yeah, you got both of yourself in a home.
I really screwed up. I ignored a patient. I was trying my best. I didn't think it was anything serious. But a patient almost died, and it was all my fault. Being called Dr. Styles doesn't make me a good doctor. What was I thinking? I'm no doctor. Not if I keep making mistakes like that. Uh-oh. Looks like rain. Hurry up, you two. We need to get all our displays inside. Rain. Maybe that'll help calm me down. It couldn't make things any worse. Sir, it looks like you're completely soaked. Did you come from a hospital? You might want to head back pretty soon. They don't even want me there. Apparently I'm useless as a doctor. Hey, you, it's me. You're never going to believe what I just saw. Huh? Well, you can guess if you want. Nope, it's even better. There was this crazy accident on Walnut between a truck and an SUV. It was nuts. The drivers flew into the street and... Huh? No, it really happened. An accident on Walnut? They're going to be taken to our trauma ward, but Dr. Cuss is out of town. And there aren't any emergency doctors on call. Woohoo! Redemption!
No, ignoring your patient this time.
Life or death. I was right. Then there was no time to lose. I'll try to redeem myself. Where are the accident victims, Angie? Dr. Stiles? The patients, he was suffering cardiac arrest and I couldn't resuscitate him. The other nurses are busy and with Dr. Cusick, I can't, what am I supposed to do? The patient's going to die, but I can't even. Calm down, Angie. Take me to the OR. Okay. Patient suffered a cardiac arrest as a result of a car accident. Multiple lacerations of the and problems in the abdomen. What's the situation? The ambulance brought him here as soon as they could. His heart isn't beating. I tried reviving him, but... Angie? What do? I need help. Angie? Dr. Stills? Only person here who needs help is the patient. And we're the ones who are going to help him. It's up to us. Only us. We're going to save him. I can't do this without you, Angie. I want to save his life. Pretend this is a normal procedure. Calm down. Think things through. First, we need a pulse. We have to get a pulse. Understood.
I will save this patient.
Let's begin the operation.
I swear this game is more dialogue than anything.
Vitals are critical.
He's flirting. He's flatlining. We have to do something. All right. So where's my thing? We need to recover his pulse. Let me explain how to use. First, move the paddles toward the patient and place them on his chest. How? Oh. Okay, I see.
Be careful.
There we go. Now I'll explain how to release the shock and hold the position. Keep an eye on the meter displaying the level of electric charge. You see the green area on the voltage gauge? Yes. Activate the shock when the meter reaches that area on the gauge. The closer to the reading you get, the more effective the shock will be. The more effective the shock will be. Now you need to know how to activate the defibrillator. Once it's moved towards the patient, press the B button and Z button simultaneously. Do you understand? You need to time it more carefully. I just fried him.
We have a pulse.
We did it. We got a pulse. Vitals are still below 30. He's still not in the clear yet. That sounds more like Angie. I know. Dr. Sales, are we going to save him? Of course we are. Understood. Okay. Oh, here we gotta go stitch him up. Hey, I got a cool on that one. That's cool.
Proceed as normal.
I got a bad on that one. I ran out of stitches. He's about to die. I'll inject him one more time. Gonna have the patient die on me. Cool. Bleeding seems to have stopped, but his vitals are dropping fast. He suffered a lot of damage to his chest. What else could it be? Oh god. Now we're gonna open him up. Here comes the cut. Who's ready for it?
The non-straight line.
Ooh, he's got a lot in his heart. Don't take this the wrong way. I don't think we have the skill to treat like this. We've recovered his pulse, so maybe we should wait for him. No, the longer we wait, the lower his chances of... I don't know what to do. I do. My decision. Alright.
I believe you have to be careful.
Whoops. That was a little... Hey. See, we're fine. Oh, good. Oh, God. I can't get it to get any closer. There it goes. Fried. Fried. Oh no. Oh no, what did I do? Oh, okay. Ow. Ow! Vital warning. Why won't you get out? I'm losing my patient. He's dead. Operation failed.
I think you were purposely supposed to fail that one.
No, that was game over. Alright, let's try this operation again. So realistic, right? We know the situation. He was brought in, blah, 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 blah. I just didn't get the big shard. I think I know what I was supposed to do.
We'll save this patient.
Alright, we gotta stitch him up first.
Vitals are critical. Be careful.
Okay.
Be careful. We have a pulse.
We got a pulse. We're good. Gotta stitch him up now.
Proceed as normal.
Alright, he's all stitched up. But he's still, now we gotta open him up. He's dead.
Oh my goodness.
Oh, here we go. Oh, here we go.
My daddy couldn't be an actual surgeon.
Who's got the stable hand in here?
We'll save this patient.
Probably got more of a stable hand than you.
Now I gotta go through all the tutorial with the defibrillation again.
Be careful.
Here we go. Come on. Pull the pink line. We have a pulse. Awesome. Now let's stitch him up. That looks like a beautiful stitch right there. See, they agreed. They gave me a cool on it.
Proceed as normal. Could it be?
I know. I'm injecting him. I got the disinfect. Got his chest open. Alright.
That's impossible.
Yeah. We know you think it's impossible, but I know what to do.
You have to be careful.
I do, but it just...
I believe in you.
We need to give him more shots. There we go. Heal his wounds. Nope, that wasn't right. That's right.
What is that?
Yep, it's a big old shard. That's what that is. And we just gotta extract it, but we gotta be very careful and make sure. See, look! You see it was out. Thank you. I think that one just gotta be stitched. But we're losing him, so I need to inject him. There we go.
What?
It's happening again. This is bad. Yeah, real bad.
Die on me. I won't let him die.
Come on, concentrate all of your suture into this wound. Alright, we got it. Got it.
What just happened?
He sutured in a split second. I think we're finished. Let's close him up. Awesome. Some more stitching. Alright. There we go. I could feel him slipping away. I was so scared, Doctor. I did not froze, and all I could think was running away. But you did. You didn't worry at all. You stood your ground and did what you had to be done. You are a real doctor. Thank you, Dr. Styles. I redeemed myself. But watch, I still gotta see. See? I've never felt way before. I think I'm starting to understand. His condition will stabilize for now. Let's keep an eye on him. Thanks for the GG. Yes, doctor. We need to contact the other doctors, and I'm way ahead of you. Most of you duty staff have agreed to come in, and I also called Dr. Kessel. Good work. Thank you. You should get some rest. We were in surgery for a long time. Yeah, if it's okay with you, I think I'll do that. Angie? Yes? Everything you said this morning was true. But I'm going to stay here as a doctor. I'm going to try harder, and I'll become a better surgeon and make you proud. If that's the case, stop coming into work late and don't leave without doing your paperwork. I'll do my best. And then there's one other thing. Please try to be more presentable. I shouldn't have to worry about you being embarrassed to work with you. Hey, I'll be more careful. Okay, I'm taking a nap. Wake me up if anything changes. I understand. Have a good rest. Dr. Stiles. From overseas. Oh, this is a Z case. Chapter 2, The Healing Touch, Dormant Ability. What the heck happened during that last operation? It almost felt like time was slowing down and I'm losing it. I knew exactly what needed to be done, but I'm not sure how I knew that. Now I'm just talking in circles. I need to sit down and figure. Derek, pay attention. Huh? I was. Stop daydreaming and start taking your job seriously. I'm sorry. We need to have a meeting about Mr. Pratt's operation. Angie can handle the prep for that. Yes, of course, doctor. Multiple trauma presents due to waste blockage. Immediate removal is required to prevent further complications. Let's go over the procedure for Mr. Pratt's operation. He's been suffering from dizziness and nausea recently. Tests show that waste accumulated in his spleen and are now blocking blood vessels there. Today's objective is to remove the buildup of the throat. The contrast medium was administered 30 minutes ago in IV. Because of that, you should be able to find the waste material using ultrasound. Once it shows that a shadow, try clipping near the area with the forceps. It should stop moving. Make your incision and then drain the area. This is the sensitive operation, so you'll need to make proper use of the magnification. Remember, the objective is to remove all thrombus in the vessels. That is all. If further waste blockage occurs, the patient's vitals will drop. Remember to stay calm and keep it steady.
Let's begin the operation.
Operation. Alright.
Let's begin.
These readings aren't good. Treat the spleen right away. Okay. Oh, okay, there we go. Now we gotta try to cut a line. Alright, we're in there. If the contrast medium is working well, we've confirmed the problem area. Work carefully, use the
Doctor. There. Then forceps.
What did he say we had to do to get rid of it? Remember? No, I wanted the forceps. This patient's gonna die. Yes, I remember the board game operation. I never was good with it.
Who's got a critique contacts?
Nope, that ain't the tool I need.
Drain the area. Doctor!
Yeah, I know he's.
Treatment complete.
I've remembered what to do now. Okay, we got this. We got this. Don't worry. Don't worry, Angie. We're good. We'll be all right. I got this. All in my butt. It's all good.
Proceed as normal. Doctor!
The change in blood flow is causing the suspended throne to move too. Doctor, this is bad. We'll be alright. We're good. I think we're good. Sorry, I got a little quiet there. It was kind of got focus. Treatment is complete. Suture the inside. Okay. Bad. At least it got sutured.
Nice work, Dr. Styles.
That was impressive. Success.
With the C rating again.
Yep. You might actually be a pretty good surgeon, Dr. Styles. Huh? You were practically a different person in there. Just like yesterday. Come to think of it, I did kind of feel like I was someone else. If you were always that focused in the art, I wouldn't have worried as much. So you worry about me? I definitely don't. I definitely worry about your patients. Angie, I'd like to review the footage of today's operation. Of course, sir. I'll bring it to you later. If you were right, then we should be able to tell from watching the tape. Master surgery. Oh boy. Here we go again. I called you here today to warn you about something. Dr. Kessel tells me you may have shown potential for the healing touch. Healing touch? You don't know? No? Doctors with the healing touch can cure incurable diseases. They can even save patients who come in with an inch of the I don't know how long this gift has existed, but the Greeks believed such doctors were descendants of. You mean the god of medicine? Me? Those with the healing touch have certain special qualities: the keenest judgment, unbreakable focus, and unmatched surgical skill. Haven't you noticed any change during your operations? Well, sometimes it starts to feel like time is moving much slower than usual. That must be a result of your extraordinary concentration. It's definitely marked you as a capable of healing touch. So I have all these powers? I have all those powers? You need to figure about them. Those things are unnecessary. What? If you pursue this, yes, you will become an unparalleled surgeon. But you are prepared for pain that would bring you. Derek, a doctor's hands are heavy with responsibility. Patients depend on us. They put their lives in those hands of ours. Can you imagine how heavy that burden would be with the healing touch? There aren't many doctors who could endure such a weight. I'm only telling you this for your own good. Forget about the power and be a normal doctor. You'll never be happy otherwise. For my own good. Think of it this way. Right now, you're standing at a large door knocking. If you continue to knock, the door will eventually open. But you can always turn your back on it, and it would stay closed. Why not take a vacation, get your mind off surgery for a while? But trust me, it's for your own good. Alright, more story. What's wrong, doctor? Derek, shouldn't you be checking on your patients? Dr. Kessel, do you think I should stop trying to improve as a doctor? So you spoke with Hoffman. I was hoping the news about your abilities might motivate him to start operating again. Huh? Why would that do that? Back when the director was still operating on patients, he named that skill the healing touch, and he accepted its gifts. What? He has it too? But then something happened. He hasn't operated on anyone since. All because of one mistake. Can you imagine how heavy that burden would be with the healing touch? There aren't many doctors who could endure such a weight. Can I really do it? Can I master the healing touch? Well, I can't tell you what to do. I'm not the one with your abilities. But I know that if you intend to use this power to help people, you need to take command of it. Take command? Yes, you can't be halfway with something like this. One simple mistake changed the director's entire life. He delved too far into something even he couldn't understand. I think you can learn a lot from the director's mistake. If you can't control this power, then it's going to cost you. So do you think I can do it? Your skill seems to involve and focus, so try concentrate on that. Once you adjust, I'm sure you'll be able to make this decision for yourself. I can't fully understand the healing touch because I'm not you or Dr. Hoffman. In the end, nobody's going to be able to make the decision for you. Good luck, Derek. I need to focus on concentration. My dad always used to say I could never concentrate on anything. He told me to imagine one shape like a star or a triangle and focus on that. I'm pretty sure he just made that up, but I definitely came in handy for exams. Maybe that could help now. I'll imagine a star. I just have to relax, focus, and concentrate. Alright, personal training exercise. Gain focus and practice superhuman concentration for self-betterment. Okay, how should I do this? First, I'll just recall what happened during that operation. Now I'll visualize a star, concentrate. Okay, I can do
Starting
it.
the operation.
Surgery! Operation time.
I think that's my mind's happy.
Okay. Healing touch, the power, I can do this. First, I'll recall the procedure I'm looking at the patient. Let's see, I think I tensed my index finger, Z.
This is all wrong.
No, that's not it. I'm too loose. Press the Z button. I think I intense.
Concentrate.
Right, what else did I do? It's my other hand, press one. Hard to concentrate when you're so tense. I know. Maybe if I draw a star in the air. Oh god. It wants me to draw a star, guys.
This is all wrong.
No, that's not it. I'm too loose.
Concentrate.
Right.
This is all wrong.
Oh my god, now it wants me to... I gotta learn this ability.
Concentrate.
Okay. Hey, let me finish.
This is all wrong. This is all wrong.
It's all about precision that I don't have, guys.
This is all wrong.
It's all wrong. It's all wrong. See, I get it that one line, 2 line, 3 line, 4 line. I can't get it to connect. There we go. I need to keep this at this though. Okay, for real time. For real this time. Concentrate. Oh god. It wants me to freehand it. Oh god. I don't know how to freehand a star. Something like this.
Do you need me to do it?
Okay. Up, over, down, up. Okay. I think I might got it. Let's go back to kindergarten and learn how to make a star.
This is all wrong. One more time.
Once more, healing touch. Here we go. Oh, I gotta learn to draw stars. Yay. I feel like I'm back in kindergarten.
That's it.
This is it. It's exactly like before. I have the healing touch. I mean, I overdid it. Gave myself a headache. Yeah, you gave me a headache. Maybe go back to elementary school. Trying to learn to draw a star. Hey, I got a B.
Holy hell. Getting better there, bub.
Just a little bit. I think I'm gonna get the hang of it. I might be able to handle the healing touch after all. Why did... Oh, because that was just a story B. That's why there's no rating on that one. Whew. That concludes our meeting. Please review the information again on your own. We should just move on to the surgical conference now to save time. Those doctors involved, please stick around. We're starting, Doctor. Dr. Stills, pay attention. Huh? What? Oh, sorry. I guess I didn't hear you. Is everything alright? You've been staring at the x-ray for a long time. I was just going over today's operation again in my head. Anyway, let's get the conference started, huh? He's been spacing out a lot lately. At least he's concentrating hard on something, I guess. Multiple aneurysms have been formed on the surface of a large intestine, require sedative treatment and suturing or affected vessels. Today's patient is Mr. Kovac, who was carried in this morning. He's currently not doing very well. Tests showed a number of aneurysms near his large intestine, some of them ruptured, and there is a risk of anemia. We need to perform a laparotomy and get those aneurysms under control. The objective of this operation is to treat the aneurysms on the outer membrane of the patient's large intestine. That should be all. First, inject the sedative into the swollen vessel to reduce its size, exercise the problem area, and suture the vessel. You'll need to get your magnification area to ensure your accuracy. Dare concentrate on your patient. Don't worry about anything else. I've saved plenty of lives, but I'm a sea doctor, J. Pring. How you doing?
Let's begin the operation.
Operation. I'm the doctor that the crooks come to. It's still burst. We need to hurry. Okay, we need to hurry. It's fine, we need to hurry.
Doctor,
That lump on that vessel is the aneurysm. Try magnifying that area.
be careful.
Try not to inject sedative.
Well done.
Now we just need to scissor it out.
Now's your chance.
Now we need to suck it out. Oh no, we need to suture it. Right. No? What are we doing? There it is.
Then forceps. Please be careful, Doctor.
There we go. We put it together. Now we need to suture, right?
Good work.
Yes. Let's close them up now. See magnification.
Aha.
Another one. Alright, we gotta take care of the next one. Gotta take the swelling down. Gotta cut it out. We suck. And then we forcep it out.
Please be careful, Doctor. Please be careful,
Oh,
Doctor.
we gotta suck the
Then
blood.
forceps.
Patient's dying. Let's give him a couple injections. Now we stitch him up. Beautiful stitching job right there. I think that'll hold real well. Oh. We got two of them that just came in. We need the needle.
Doctor!
aneurysm erupted. We need to stop the bleeding. Alright, then we grab the forceps. Connect it. Let me suture it.
Doctor!
I know it erupted. Get in there. There we go. Now we need to suture it.
Well done.
Magnifying out, magnifying in. Pull this out. Ah, that one erupted.
Doctor!
I know, I'm trying. They keep erupting before I can get to them. I'm trying. Suture them up. There we go. Good work. I think it settled down for the time being. Coffee. I tried out a new game during your stream. Oh, Scribbled Knots is actually a pretty good series. I really enjoy those. They're a good game. Coffee. And Retro can't get a nap yet. It's gotta work in the morning.
This isn't good.
Yes, I know this isn't good.
Your ability.
Well,
Vitals dropping.
I'm about to kill my patients, so I'll just let them erupt.
Doctor! Not much
It's
time
okay.
left.
I'll just keep this going. I grabbed that. Gonna die again.
We're running out of time.
I know we're running out of time. I'm gonna run out of time. Yep, I'm out of time. Out of time. Yep, patient dead. Operation failed. Yeah, they're pretty fun. We failed that operation. We didn't do it fast enough. So we gotta go back to it. So this game is all about speed. Oh, the new one has, yeah, I hadn't played the new one yet. So it has mini games now added to it. Cool. Huh, it's interesting to know it's more of a party game now. But I was telling you, Retro, there's the baby powder.
Let's begin the operation.
Alright, operation time. I'm gonna have to laser focus this. It's getting to the point where you gotta laser focus in on this stuff. You
Let's begin.
can't just slack off anymore. Oh, he's gonna die because it missed the one line. Yeah, I know it was bad. Just leave me alone.
Doctor, be careful. Well done. Now's your chance. Doctor, bend forward ups. Good work. Aha. Bend forceps. Doctor!
Right, interrupt before I can get to it.
Vitals dropping.
Yeah, I know. Vitals are dropping. Be alright. Give him a couple shots and we'll be alright. Ah, blood. As soon as I went to grab the
Please be
forceps.
careful, Doctor.
Alright, come on.
Well done. Doctor!
Yeah, I know.
Vitals dropping.
Stitch him up.
This isn't good. Maybe your ability. Doctor! Vitals dropping.
Pull that back there. I'll pay attention to y'all in a minute. Hope you guys don't mind.
Please be careful,
This
Doctor.
operation's a little tricky today. Don't want to run out of time again. We are operating. This game does take a lot of concentration though. Didn't even realize it. Definitely. There we go. Let's close them up. Awesome. We did it. Now we can stitch them up. Call it a day.
Nice work,
There we
Dr.
go.
Styles.
What's the purpose of that? Improve groups so it doesn't fly off your hand, or is it so you can slap the games with gusto? Oh, the baby powder is just it's a special effects for when we slap the games. Get a handful of baby powder and just slap the game and it, yeah. No, because I don't want to ruin the game. I just want to give it a nice little swat on its cover and tell it to go back to its shelf. So I understand you figured out how to control your healing touch. Make sure you don't rely on it too much. You need to develop your basic skills too. I didn't rely on it. Huh? What the? I know it won't be easy, but you didn't take the job because everything's going about going black. Derek, are you even listening? Derek, what's wrong? Ooh, something going on. Intriguing. Intriguing. Forget about the power. But are you prepared for the pain that would bring you? I become a doctor so that could help people. And if it cost your life, you'd give up your own happiness? I don't know, but I don't know that people need my help. And I want to help them. Oh yeah, nice, good for keeping them nice and fresh. That sounds right. Smelling like lavender. What? Where am I? It's the ceiling. What am I doing here? Dr. Styles? Angie, what happened? After Mr. Krovik's surgery, you just collapsed. You've been asleep for 3 days. What? 3 days? What about my patients? I have operations scheduled. Already taken care of, Derek. I called the other doctors. But that's in the past. We need to discuss how you're going to proceed from here. Okay. Derek, I forbid you from using the healing touch like that. What? Why would you? The ability puts a tremendous amount of physical strain on your body. It's too risky. What if you collapse in the middle of a procedure? But without my healing touch, Mr. Kovic might have died. Exactly. That is why you must have abandoned the healing touch. I advise you to use only when absolutely necessary. After all, you shouldn't be relying on solely healing touch anyway. Developing your natural skills as a surgeon is far more important. We can't assume the healing touch was the only reason Kovic survived. If you want to help people, then focus on strengthening your natural abilities. I understand. Take it slow, and I'm sure the power inside you will find its way out. Become the best surgeon you can, and one day I'll inherit full heritage of... Yes, sir. Just let me die. Oh, we got a patient who doesn't want to be under the knife. Bet you that was exciting. Nice fresh layer. Oh, that had been pain trying to get it out of the cracks though. Doctor, an emergency patient that was just carried in. Vitals at 60, CS is 30. She's in shock and losing blood fast. Call the rest of the staff. We need to operate immediately. Angie, get the patient in the OR. Derek, you handle the surgery. I'm on it. Several bleeding lacerations found in the right lung. Patient's vitals are unstable. Necessary extreme caution. Patient is a 17-year-old female. Her case history is unknown. We found massive bleeding in her thoracic cavity. Derek, you need to perform so immediately. The operation has one objective: treat all injuries within the thoracic cavity. We'll all proceed from there. Drain the blood first. It's a large laceration. After that, you'll use your forceps to close the area, then suture it. Just be sure to drain any blood before moving on with the operation. Hurry, Derek. Oh, that was funny because the room was covered, but my piano was sad. Operation. That is kind of funny in a way. You're right.
There isn't much time.
Baby powder can get all over things. Alright, time to open you up. Oh, maybe open you up. I don't like your vitals right now. Well, what happened? Could something like this? But there aren't any external wounds. This isn't possible. No, it doesn't matter what caused it. We need to focus on stopping that bleeding. Understand, doctor. Let's begin treating her.
You have to be careful. Doctor.
Alright, pinching.
Vitals dropping.
didn't even get a minute. Patient died. Operation failed. Knew it. I knew I should have injected her. God, you gotta be quick on that thing, on the pole there. I know, Miss Independent. Dang cat. Using a cord as a chew toy.
Let's get started.
Alright, let's try this faster this time.
There isn't much time.
I know there isn't much time. Trying to do this fast last time.
Doctor, good work. Vitals dropping. Doctor,
We're done treating us, I think. Move on to the smaller ones. Just relax. Although those gotta be stitched too. Everything's been sutured. She's going to be making it. I hate to think about what would happen if I'd ride later. Close up.
nice work, Dr. Styles.
You did well, Dirk. Success. Yep. Have a good night, and I will continue to be good Dr. C. See? Rookie. Dr. C. Where and what do those injuries come from? I don't know. It'll probably take some time to figure out. She'll be hospitalized for a few days, so let's just try to keep an eye on her. Did you notice those cuts along the girl's wrist? Yeah, they looked recent. I'd say her real illness is deeper than we thought. If that's the case, I don't think we're finished seeing complications. Oh boy. I'll be back on my table. Yes. Get away. I never asked to save me. Leave me alone. Please calm down, Miss Reed. It's alright. When I passed out, I could have felt it. My chest was on fire. I was finally going to be free. Why did you bring me back? I don't want to live. Why would you want to die? You're still young. You have your whole life ahead of me. Yeah, there's something to look forward to, huh? How come everyone says that? My life sucks. I'm tired of all this pain. I'm not pretty enough to date the popular guys. I'm too fat. My mom called me a failure yesterday because I might not even graduate. Is that a life you want? I'm never going to be happy. It all depends on depends on my attitude? What a joke. Positive outlook. It won't just magically solve all my problems. Then maybe you should die. There are patients here who have to fight just to breathe properly. Every day someone dies after a long and painful struggle to hold on. I'm sorry we saved you. Go into your life for all I care. Angie, I know you did your best, doctor, but I'm afraid that it was a wasted effort. Stop talking like that, Angie. I have other things to attend to. I'm sorry you had to waste your time operating on old me. Helping someone is never a waste of time. Just leave me alone. I don't blame that nurse for hating me. I hate me too. I'm not going anywhere. You're still sick. What kind of surgeon are you then? I thought you fixed me. It's not that kind of sickness. The doctor's job is about more than just physical illness. Nurse Angie taught me that. When I was little, I had a cat named Tama. We were playing one day and he ran out into the street. Yep, so it was mental illness. I don't know, I'm just giving these characters some kind of life. How I feel. We were playing one day and he ran out into the street. I wasn't fast enough to do anything. A car hit him and I blamed myself. I decided it was my fault. Tama died. I really thought I had killed my cat. It was all I could think about. I told my mother I did a terrible thing and I wanted to die. What happened then? She slapped me hard. Mom told me Tama would be ashamed of me and that she was too. But she also said that was the one who should be most ashamed of myself. She said that to you? Who would you grow up with, Linda? Huh? Do you have any siblings, or what about pets? Just my parents and my friends at school, I guess. Oh, you weren't expecting to be anime? Oh, come on now. I guess you never saw the box art. Yeah, it's a big hit. Could you look at those people in the eye and tell them you wanted to die? No way, of course not. That's why I want to be left alone. And hold this. Mirror. It does, doesn't it? That box art? And just think, I think there's 2 more Trauma Center games on this on the Wii we get to have fun with later on. Look at that girl there and say, I want to die. Yeah? Man. And it's one of those skill-based games. I'm playing on easy, so you see how much struggle I'm doing on easy. You can imagine if you bumped it up to hard. I couldn't do it either. Now tell her you're sorry. I think she deserves an apology. Oh, sorry? Sorry. So sorry. Stop worrying about other people and start making that girl happy. Don't work hard in school for your mom's sake. Do it because you'll learn more and become a better person. Don't let other people decide whether or not you're happy. Find things you enjoy and do them. It might not make you popular, but you'll like yourself a lot more. And you aren't too fat. I've seen your charts, remember? Your mother sounds like a smart lady. Really? She could be pretty weird sometimes, but then she'd say, I may be weird, but think of all the stories you'll have to tell one day. That's interesting. Sorry, I guess I got a little carried away. Really though, she's great. I should let you rest now. I think I'm gonna take a nap. That's a good idea. Sorry for talking so much. Next time I'll thank you. You're a good doctor. Recollection. Let's go on. I was not expecting to have this deep of a story and intrigue me as much. I was like, oh, I'll just go in there and start doing some surgeries. But man, the story on this. Woo. Time for a break. I'll go get us some coffee. Thanks. That's a great idea. I passed by Linda Reed's room on the way here, but something wrong? Her parents were there. All three of them started crying and apologizing all at once. It seems a lot more was going on than we thought. School, her father's job. Were you eavesdropping? Well, I was curious. I didn't hear anything worth dying over, though. Everyone worries about the stuff during high school, you know. I think we'll handle our problems in different ways. But I'm glad her family came to visit her. Surgeons aren't really equipped to heal psychological wounds. Don't sell yourself short. I can only try. Anyway, if your family knows about it, then they can help her. Yeah, I think she'll be fine. That girl's lucky she was brought to the hospital, though. Huh? Why? Well, this is only a rumor, but I hear there's a death doctor. What? Doctor? Who's this, Anna? If the doctor had been treating her when she asked to die. Death doctor, huh? I really can't understand why anyone would want to die. Yeah, a good story makes it more interesting. This game actually this is like a kind of a remake of the one that started the whole franchise, which was on the DS. Derek, we just received some strange results back on Linda Reed. Do they explain the bleeding in her lungs? I don't think it's directly related, but they found extremely high levels of endorphin in her blood. Zeroprobe? What's that? It's new anesthesia, doctor. They usually used to treat allergies. I know what it do, but why didn't she tell us she was on medication? Because she wasn't. Drugs involving her are still in clinical trial. Also, our tests indicate 24 times the suggested dosage. Side effects from overdosage include headaches and emotional distress. In extreme cases, the mood swings are serious enough to prompt suicide. That explains her death wish. It may be contributed, but I doubt that was the primary cause. Still, I've never heard of serotonin being synthesized within the body. Whatever's causing it may be the source of those lacerations. Doctor? What is it? Reed's condition is getting worse. She's complaining about chest pain. What? It hurts! Linda? Doctor, I want to live! I want to live, doctor! Please! Derek, we're operating now. Angie, alert the staff. Hurry. Hemorrhaging lacerations reformed in the right lung. Please conduct an investigation while performing hysteric treatment. Her blood pressure is decreasing at a frightening rate. We suspect her hemorrhaging in her lungs again. There has to be some explanation for why these lacerations are occurring. Until we figure out what that is, there's not a lot we can do. We should have two objectives during this operation. Treat any bleeding injuries within the thoracic cavity. Discover the source of lacerations. I'll be working as your assistant. Stay calm, Derek.
We'll save this patient.
No, she wants to live. I have to save her. Begin operation. Alright, here we go again. Why now, she said. She wanted to live. I don't know. These are symptoms don't add up. Derek, take extra care during this operation. Angie, keep an eye on the monitor. Good luck, everyone. I knew it because I was hesitated. Is there blood still there? Alright, gotta inject her a couple times so I can get the next one.
Proceed as normal.
What's our next step? We need to close her up and have a closer examination later.
What is that?
What the? What's going on? Doctor, try using an ultrasound.
What?
Treat that like a tumor. Okay. Oh. Come on. Go. Where'd it go? No, to treat it like a tumor. It won't let me grab it. It won't let me grab it. Alright, we'll get to that here in a minute. How you doing, Turtle?
Please be careful, Doctor.
I'm trying to treat it like a tumor. It won't grab, though. I'll find the thing again. Where'd it go? Maybe it's a laser? No? I know it's a bird. It's telling me to treat it like a tumor. But it won't let me grab it.
Not much time left.
Vitals dropping. Vitals dropping. Okay. See, it's still here.
We're running out of time.
I just saw it. Where'd it go? Where did this little thingy go? Patient's dead. Yeah, I know. Sketchy sutures, dude. Yeah, I know. I gotta figure out that part. Alright. Back to the surgery. I gotta figure out how to complete.
I will save this.
The only raise I can give Turtle at the moment for this is 2 free picks off of a list. As if Turtle wants to pick 2 more games. I think he has the list. Kapow! Were you happy to be here, Jay Pring, for that? See the very first baby slap? Alright. Yeah, I can send that right on over there.
Let's begin.
Alright, let's begin. Cool. Yeah, we need to fix all this. Yes, I know.
Proceed as normal. Vitals dropping.
Ah, vitals dropping. I need to close it back up. Alright. Come on. Gotta get her vitals back up. And then we can work on the suturing. There we go. Nice job, Derek.
What's that?
Anita.
What?
It's moving. Derek, treat it like a tumor. Exercise it and remove it. Don't you usually have to grab it to exercise it? Alright, I'll get those added onto the list. Put it. Which do you want first? Psychotroid.
Please be careful, Doctor.
Trying to remember. Okay, I gotta remember how to do this. I'm gonna look it up real fast. Because my brain is not remembering how to do the tumors. Well, one thing I do gotta do is remove my keyboard from the slap zone when I do that. Definite. That's all up to... Using the you can find a mysterious blue creature inside the organ. Grab a scalpel to cut it out, and then once it appears, uses it with a laser to hurt it. Defeat. It's gone, Angie. Using the laser was the right decision. Good thinking. It won't have... Oh, there's another one. Alright, well then we'll drop your... Get your... these up. And then we will find that little bastard. I thought I had it. Where's it at? Where's the little bugger at? Dang it! You got away.
Not much time left.
I know, I'm trying to find the little bug.
Vitals dropping.
I got 40 seconds to finish this surgery. Why does it keep jerking over like that?
We're running out of time.
Yeah, I know. I'm trying to heal up. I don't have enough time. Oh my god. Ooh, this game is getting rough. Real rough. Good story, but now we're getting into some hard zones with this. It was like, alright, we can chill and chill and chill. Let's go! Step on the gas.
I will save this patient.
Yeah, we know. Get to the surgery. We know what we're doing now. Maybe. I can actually cut. I knew it because it didn't stitch right. Come on, close the wound, stitch.
Proceed as normal.
There we go. Nope. What is that? What is that? We know what that is. As soon as we can find it. Feet.
Vitals dropping.
Oh god, yep, it's more of them.
Please be careful, Doctor. They keep coming.
Gotta give some more life to the patient. And we'll get that last one.
Vitals dropping.
Vitals dropping? Okay. Thank you for letting me know vitals are dropping. Turtle just not gonna let me. Okay, gotta find the bug again. Where'd you go? I can find it, but then I gotta really got his own. Ah, stop hiding. We did it. Let's close her up. Alright, cool.
Was that guilt?
What's going on? Why did they both stop talking? Derek, continue. Please suture. Just please suture.
Nice work, Dr. Styles.
Linda should finally be able to cover. Thank you, Dr. Styles. Awesomeness. Alright, we got that one. Give me my Yeah, there's my C ranking. I am Dr. C. Be considered strictly confidential. Bring Linda Reed's medical files to my office immediately. I will provide updates and appropriate. That's all for today. Doctor, could that have been guilt? How do you know about that? I don't know much. It was mentioned in my father's research. When did your father come across something like guilt? Well, he was a researcher. Other than that, I don't really know. Give me some time to explain this situation. Until then, don't mention guilt to anyone, understand? Yes, sir. What the hell is guilt? Alright, cut this. Alright, here we go. I'm here. Please come in. Pardon me, why was I called to your office? Why don't you have a look at this examination report? What's this for? Linda Reed. What do these headings mean? I don't recognize them. Positive, currently rare. Guilt, positive. Spectral NSGR, G1R. These tests are beyond your capabilities, so we enlisted help from the outside organization. In the last few years, a bizarre disease with varying symptoms has been reported. In several isolated cases, the two things they had in common: each victim's body's turned against itself, and they all died. Because of that, we believe each subject was infected with guilt. Then you think Reed's illness was? Exactly. Lead Reed is a guilty victim. I'm surprised you were able to treat her with the proper resources. It was a difficult operation, but I wanted to save her. Well, that decision may have changed your life. The organization we mentioned before has requested that you join them. What? Why me? Your healing touch ability allowed you to successfully cure a guilt victim. What organization is this, anyway? They're arm of the World Health Organization that specializes in exterminating intractable diseases that threaten mankind. They're called Catechus. Catechus? I remember seeing them listed in essays on cancer and AIDS treatments. And they were the ones who had eradicated the TFTA influenza last year. Catechus wants me? What are you going to do, Derek? You've been offered a chance to work at the forefront of modern medicine. Well, I mean, it's an honor, but it's also so sudden. I'm not really sure what to do. I mean, it changed my whole life. You don't need to decide right away. Just remember that this is your choice, not an order. The only reason I'm telling you this is because an old friend asked me to. To be honest, I'm against you joining Catechus. What? Why? I don't think a research laboratory is the right environment for you. Didn't you just say you wanted to help patients face to face? That's true. You should probably see this as well. Letter. Death is denied those who seek it, though it be their destiny. They search for it like treasure, but the modern age conceals it. What's this supposed to mean? It arrived shortly after Lita Reed was hospitalized. We don't know who sent it. Supposedly these letters arrived shortly before guilt does. That means guilt doesn't occur naturally, which means it could be some kind of man-made virus. The World Health Organization is considering it a terrorist activity. What? Someone is creating guilt and releasing it into society. We don't have any leads to who or why, almost as if it was meant to confuse us. The UN even created a new term to describe it: medical terrorism. Catechus is appreciating a large-scale guilt outbreak, and they need skilled doctors to be ready for it. Hopefully now you see the stakes involved in this. Think it over. Don't make your decision lightly. Alright. For the greater good. Oh, Hope Hospital, room 207. Thank you so much, doctors. It just hurts so badly I thought I was a goner. Well, an appendix is a fairly common condition, but congratulations on your recovery, Mr. Sanso. And my wife gets sick, I'll make sure you're the one operating on her. Well, it would probably be better if she didn't get sick at all. I guess that's true, haha. Talking with patients is one of my favorite parts of the job. Could I really leave that behind? Derek, we'll be starting the operation briefing soon. Okay. I didn't mean to skip that. Today you will be operating on Elsa, who has been in our pediatric ward. She has a very young child with severe heart disease. It was a tough decision, but her parents finally decided to go ahead with the procedure. The only main objective for this operation: replace a valve in her heart with a synthetic one. You'll use a triple incision to exercise the valve, cut 3 times. You'll need to be as cautious as possible, understand? Technically, it made a lot of situations much easier for us, but heart surgery will always rely on a skillful doctor. Angie, keep an eye on the oscilloscope to aid Dr. Stone. I understand. Don't let the gravity of this operation intimidate you. The confidence is over. She's in your hands now, Derek.
Let's begin.
Operation. A report details frequent concurrence of light or be ready to be on this, but just in case. Let's get started with the operation. What the hell is slowing her abnormality? I'll attempt to stop the convulsions. 3, 2, 1, clear.
Vitals are critical. Doctor,
There's a good chance her heart will continue to go into the convulsion. I'll stand by with this defibrillator in just in case we need to use it again. And if it happens, I'll need to recover her pulse as quickly as possible. Alright. Inject this twice. Stand by.
vitals are critical. Doctor,
I was trying, but the thing just jerked. Is the batteries going dead on this remote? That's what it's acting like.
doctor,
Let's begin the valve procedure. We'll exit 3 stages, but before that, we'll need to drain this blood. Before that, we need to give her some life.
vitals are critical. Hurry, doctor.
Dang it. Dang it. I know we need to drain the blood. There she goes in that mode again. Stand by. Look!
Hurry, doctor.
I'm about to kill the patient again. Okay. Ah, defibrillation again. Okay, is this no? Why is it being so stupid? Timing. There it goes. Such delicate surgery. I'll be right with y'all.
Proceed as normal. Treatment complete.
Alright, pause this for a minute. Remind me if I'm dying not to have you do my surgery. Yeah, I know. I'm a Class C surgeon. I'm only good for the crooks. So long as you ain't a crook, you're gonna be alright. Valve exit, please place it on the tray. Okay. I know what we gotta do. Flatlined again. Heart surgery's hard. Come on. Oh,
Not much time left.
I know.
Amazing.
Good work. You're getting better at suturing. The valve transplant is complete. Let's finish up here.
We're running out of time.
What a relief. The operation was a success. Now she can play outside. Please close the incision. Okay. There we go. Awesomeness. Poor girl, she's too young to go through something like this. Having someone cut open her chest is so unnatural, but something in that little heart refused to give up. Maybe it sounds silly, but I keep
Nice
thinking
work,
about it.
Dr. Styles.
The human body is truly amazing. Ah, success. Give me my C rating. See? C. I'm Dr. C. Thanks for the GGs. Turtle, did you prefer Excite Truck or Call of Duty first? Yeah, mission passed. Is my daughter Will Ellis be alright? The operation was a success. So she'll need about 2 months to fully recover before she can come back to school. But after that, she'll be good as new. Alright, Excite Truck will be up after Super Monkey Ball. That's good news. Oh, thank you so much, doctor. People are always worried about her heart surgery, especially on children. What, Excite Truck or this? Because I know you said you hadn't played this one. Oh, Excite Truck, yeah. But modern medicine allows us to treat such good conditions with much greater success than 10. What the? Even just 5 years ago, young patients like your daughter face very little risk of permanent physical damage. To be honest, I'm more worried about the psychological stress operations. like this might have on small children. Please take good care of her during her recovery. Of course. Elsa, we love you so much. Modern medicine. I'm very sorry. Modern medicine just hasn't advanced enough to treat a disease like this. You have my condolences. Mom, why are you crying? Dad's okay, right? He's gonna get better, right? But why isn't Dad getting better? You can fix him. You just gotta. He's my dad. I'm sorry, son. No doctor in the world could have saved your father from this. Things have come a long way. Dr. Hoffman, I'm going to accept the offer from Candace. So you're willing to throw away your own happiness for this. I know about what happened to you in the past. I know that your having superior skills will only create more pressure to succeed. That everyone will expect me to have answers nobody has. I'm sure those are the valid concerns, and the path I've chosen will probably cause me a lot of pain. But I have become a doctor so that nobody would have to die from an incurable disease. Not ever again. Diseases are painful, and losing someone to a disease is even more painful. It's hard for a doctor to tell people they love the ones that can't be cured. I'm going to make sure they won't have to. Candace already found a way to save thousands of people. If I can somehow help them find cures for incurable diseases, then I'll accept the responsibility. I'm joining Candace. We're on chapter 3 now. Yes. Today be Derek's first day with Candace. Are you worried? I wouldn't say worried. We're down one doctor and one assistant. It won't be easy to operate with two of our people. Well, Derek has potential, but he's far from perfect. I wasn't about to send him to Candace without an assistant he's comfortable with. Besides, Candace is supposed to help us find replacement staff. I see. Still, I didn't expect Styles to be selfless and human type. Don't you think he'll be able to handle the pressure? I suppose we'll find out. He's going to be a surprise. I didn't get a chance to tell him about Sydney. Uh-oh, who's Sydney? Gotta figure out who Sydney is. An international organization seeking to eradicate disease is the American branch. There are additional branches in Europe and Japan. The U.S. branch less licensed research anti-infection methods. It's only idea as top secret offshoot of Department of Health and Human Services. Once the organization went international, the central agency was renamed Catechus. They authorized to act on their own outside the government. Dr. Stills, you may come in now. Hello. Huh? Welcome to Catechus, Derek. It's nice to meet you. I'm Sydney Castle, the director of U.S. Opera. My brothers told me a lot about you. I'm glad you decided to accept our offer. A third chief director, he's clinical medicine after his wife died of tragedy. Okay. Oh yeah, I think Dr. Castle mentioned you having a brother. I mean, it was an honor to even be considered for the position. Angie Thompson, would you come in as well? Yes, sir. Well, it's a pleasure to meet you too. You're young, but I hear you hardworking and sharp as a tack. I look forward to seeing what you both can do here at Cut. Thank you, sir. I'll do my best. The Secretary of Health and Human Services should be here shortly. When I told him you were both coming today, he insisted on stopping by. He's in charge around here, so I'm sure you'll be seeing him a lot. Right away, Mr. Secretary. Congratulations, Derek, Angie. I'm Richard Anderson. Well, perhaps it would be more appropriate to thank both of you. Current Secretary of Human and Health. After a long career in politics, he became the Executive Director of Thank you for accepting such a dangerous job. I'm told the operating on guilt puts a surgeon at risk too. And we still know who is responsible for spreading it. But from what I hear about you two, you're up to the task. Scientific advancements, DNA treatments, changing social environments. We live in challenging times, and it's our responsibility to research and develop treatments that ensure the stability of world health. What all this means, I'm pleased to have you both on board. I hope you will do your best and take your work seriously. Yes, sir. And this is Dr. Clarks, our resident surgical expert. Oh, I wouldn't say an expert. There's always room for improvement. He has a wife and 2 children. He's kind to manner, as blessing and comforting to many patients. Nice to meet you. I'm Stephen Clark. Nice to meet you. I'm Dr. Clarks. This is our answer to Dr. Myers. The name's Sue. Nice to meet you. A well-respected, she used to be Iron, now fix it. Alright. You're from Hope Hospital, right? Isn't that Greg Crystal's house? Do you know him? We went to med school together. He's helped me in a lot of ways. I'm actually the only person here who knew Sydney was his younger brother. Anyway, if you have any questions, don't be afraid to ask. Of course. It's nice to meet you. Some of those staff aren't here today, so you'll have to meet them later. Think this will lighten our workload? Doubt it. Have you taken a look at the list of incoming patients? Oh well. Have you guys been working with a lot of patients here? The public isn't aware of this yet, but we're on the verge of an outbreak. Congress recently voted in favor of giving us a budget increase, but that wouldn't be good enough. At the rate, we won't need to start treating patients until tomorrow. So far today, let's get all the paperwork out of the way. Sounds good. Jeez. Who knew filling out employment forms could be so tiring? It's pretty late. Yeah. Hey, we'd come to Cada's anyway. Does it matter? Well, I was just curious why you decided to join too. Dr. Kessel recommended me. It's not what I meant. Or it seemed like you knew something about guilt, so does it have anything to do with your father's disappearance? Not really. News that I'm ready to respond to. I wanted to be here on the front lines of modern medicine. It's the same as you wanting to become a master surgeon. I want to be a master assistant. That's really all there is to it. Guess it makes sense. We'll work hard together. The potassium chloride's ready, so if we could increase the... Sounds like someone's on the phone. Derek? Sorry, gotta run. Yeah, I'll get back to you, dude. No way. Tyler? No way. No way. You seriously work here now? He went to med school with Derek. Tyler's very optimistic and tries to keep everyone in a good mood. Yeah, I started today. I must say, it's very much a pleasure to meet you, gorgeous assistant. My name is Angie Thompson. Nice to meet you. Man, I heard the new guy's name was Stills, but that's rocks. I don't think you were adventurous enough to join Canada. And I mean, you weren't exactly an A student, man. But everyone here's been hyping you as a highly skilled surgeon. What? Nobody told me anything about that. I don't want people expecting too much from me right away. Well, you're pretty good track record so far, Dr. Steele. People can change a lot in 3 years, you know? What about you? You were probably one of the top 5 in our class. I guess you can see for yourself, hmm? Good luck, man. We ought to go throw a party or something. See ya. I can't believe Tyler works here. Oh, sorry. Tyler's a friend of mine from med school. Yeah, I kind of figured that. He was the professor's favorite, so I guess I assumed he'd still be taking classes. Potassium chloride, huh? I wonder what he's doing animal testing. Well, we're going to do our next operation. Several guilt victims are currently hospitalized here. We obviously need to treat them ASAP, but we don't know how, so at the moment we're trying to slow the disease progress. I had a lot of trouble operating on guilt as well. Today's patient is similar to your previous experience with guilt. I watched the video footage of your surgery at Hope, but you moved so quickly I couldn't tell what was going on. I'm looking forward to seeing you in action today. See what you got, buddy? I don't need any more pressure, thanks. Dr. Myers will handle the anthesis. No problem. Myers is a tough chick, Derek. If you screw this up, don't expect her to ever work with you again. Stop trying to scare the newbie, Chase. This is a difficult operation and we don't have room for any mistakes. Just do your best, kid. You got it. Positive Kuro bodies detect immediate removal is required to prevent further complications. I'll be briefing any procedures for this operation. Patient is a guilt victim who has brought you here 3 days ago. Derek, you actually operated on this exact strain already. It was called Cura, wasn't it? Correct. The guilt it hides inside the organs while attacking their tissue. Removing it, however, should be like removing any parasite. One of the simple cases to evaluate your abilities. There's only one objective in this procedure. I'll leave the exact details of the operation to your discretion. Show us your talent. Yes, sir.
Let's begin the operation.
Operation. It's the same strain as guilt that Lee and Reed had the hot chart. Let's begin. Alright, here we go.
Doctor, well done. We've located the guilt. Amazing!
Alright, there we go. Now we got more. I'm gonna find these two.
Keep coming! Vitals dropping.
Vitals dropping, okay. Inject them twice. Now we find the guilt.
Has to be here. Vitals dropping.
Great work. It's over, Derek. The crit. Negative. Let's treat the. Yep. But we need to bring the vitals back up. Just a little bit. And we can suture up. Alright, close them up time. We were Angie, that's very observant of you. Guilt creates cells with an unnatural. Using chlorine, we can detect the specific wavelength they emit. So far, that's the only way to do reality. Remind me to give you the chlorine test equipment later. Finish up by shield. Excellent work. I can see why my brother recommended you. Awesome. We're getting better at this operation stuff. Success, man. Oh, I come over here and I become a bee doctor. I must be getting better. Unbelievable. He's still got a lot to learn, but that was incredible. The owls finished 30 minutes earlier than we estimated. Hopefully the patient will recover quickly as well. Hey, looks like times have changed. Hey Tyler, you around? Where could he be? I didn't think he'd had any patients today. Huh, this is a new thesis. I guess he still finds time for academics after all. Netherlands or Ethan. Why would he keep Ethan's leases in his files? Oh, there's a letter. Thank you, doctor, because of you, my husband finally found peace. What the? We'll bring that up in the next conference then. Crap, he's coming back. Where do I put this? Hey, what's happening, Derek? Did you need help with something? I was just coming in to ask you about something. It was, alright, medication for guilt patients. Post-op medication? As far as I know, there hasn't been any. Oh well, okay, if you don't know, then I'll just... Sorry to bother you. See you later, okay? Wait, Derek! I've been meaning to show you something. You would have found out about it sooner or later anyway. What? I swear I did. Follow me. Hey, Tyler. Hey, you're about... How you doing, Amy? Not so good. Oh, that sucks. Sorry I made you get up. Derek, this is my sister, Amy. She's been hospitalized here for 2 years. You mean she's infected with guilt? Yeah. Amy's condition is the reason I came here in the first place. Amy, this is Dr. Styles. He's an old friend of mine. He's gonna be treating you, so go easy on him, okay? Okay. Did you come to examine her again, Dr. Chase? H, one of the many nurses on the staff. She's currently looks after several guilt patients, including Amy Chase. Nah, I just came to see how my little sis was holding up. Oh, I see. Amy hasn't been doing her homework lately. I was actually hoping you could talk to her about that. But it's so boring. Sis, if you slack off, then you'll end up dumb like your big brother. You want people to know how smart you are, don't you? Think about it, okay? Anyway, big bro's gotta run. But I'll visit you again tomorrow. You must be going through a lot, Tyler. Yeah, I guess it's a paycheck for what I've been doing, huh? Huh? Look, dude, I know you saw my paper in that letter. I've been practicing everything ever since I graduated. It's my deep, dark secret. I've heard rumors but I never thought the Death Doctor could be someone like you. Why would you do that? One of my professors I had before we met died of cancer. It was already too late. Why they found it when Professor Boca told them that himself. All he had left to look forward to was a few weeks of suffering and painful treatments. Good people shouldn't have to go through pain like that before they die. So I gave him the gift of painless death. But that's... Of course people would prefer to live on it. It's only natural. But everything causes pain and there's no chance of recovery. And you are really living. No, you're just sticking around so other people don't feel bad. This isn't true. I know it's naive, but I knew there might be consequences when I started doing it. You probably think it's just suicide, of course. Or worse, murder. But things are different now. I have to be there for Amy. If you're going to turn me in, at least wait until Amy's gone, okay? You aren't doing that to Amy. I won't let you. Ooh. Another time to do some more surgery. Doctor, quickly! Amy's condition is getting worse. Her vitals are dropping and she's losing consciousness. What? Everyone prepare for surgery. Angie, bring you in the patient. I'll meet you in the OR. Hurry. Yes, sir. Tyler, this is an emergency. Come on, hurry. What are you doing? Let's go. You can't operate on her. What? I have to. Haven't you seen the PET results? The guilt's already migrating. Her respiratory system is in trouble and her digestive tract is next. What are you supposed to do? Are you just going to watch her die? Do you have any idea how many things we've tried? Dr. Clark couldn't help. He's the best there is. All he can do is thin out some of the tumors. I just watched her get weaker day by day. Amy doesn't have a lot of time left. What are you supposed to do? I'll tell you. You're supposed to leave her alone so she doesn't have to suffer. You really think cutting her open again and again is going to do anything? So what? You want us to watch guilt tear her apart? You don't get it. She doesn't need to go through all this suffering. Even if the operation helps, she might never open her eyes again. She'll just be connected to some machine waiting to die. If that's the case, then I'd rather send her off myself. You call yourself a doctor? I'm Amy's brother before I'm a doctor. You think I'm going to watch my sister suffer just because that's my job? I don't care if I lose my license. We're talking about my sister. What are you still doing here? Hurry up. Dr. Clark's? We may not be able to operate. What? The guilt in her lungs, they moved a lot faster than we expected, and I'm afraid she's not strong enough to survive the surgery. What if we separate the operation into 2 procedures? No good. If we don't extract the guilt entirely, it'll be right back where it started. Nah, do you get it, Derek? This is how it always works. It's always knew it would come down to something like this. I'll operate on her. She'll be okay. If we can extract all of it, right? Leave her alone, you bastard. With the healing touch, it might be possible. Tyler! Amy! Tyler, please do the operation. I know you could hear us. Aren't you scared? No, I'll be fine. You worked so hard to become a doctor. I'm going to try hard too. I'm glad that you're a good doctor. I thought I was doing what was best for Amy. But I was just a coward. I didn't even consider what she wanted. Derek, can you handle this operation for me? I don't deserve to touch her. Not with these hands. I joined Kaizen so I could help people. What about you, Dr. Chase? Shouldn't we do everything we can if we might save a person's life? Yeah. Dr. Chase briefed Dr. Styles on the furthest strain of guilt. Yeah, no problem. Hang in there, sis. We'll be alright. And a really gnarly one. It replicates that its DNA while actively moving throughout the body. That's possible. Well, to be fair, moving, it's kind of a bad way to describe it. It copies itself to other locations, so it's just like it's moving. Basically, it keeps replicating its DNA and creating new tumors. That's horrible. Good news, though, we might just know its weak point. What is it? It comes into 2 flavors. We'll call them Type A and Type B. Type A and Type B like to eat each other when they meet up. But they're both equally strong, so you kind of got to just stall there. And if they're not moving, they're just like an old tumor, right? So after we drain the guilt's tissue, we can just Hopefully, I mean, this is all theoretically. One wrong move and they multiply, so there's no room for trial and error. It's like we could safely test the theory before trying it. You have the healing touch. I've seen you use it, man. It's amazing. If anyone can save Amy now, I know it's you. I don't need to tell you the objective of the operation, do I? Please, Derek.
Give up.
Operation.
There isn't much time. Doctor,
When they combine to form a tumor, use the drain to remove them. That's the plan. Are you ready?
We've located the guilt. Doctor! Chiral reaction decreasing. Doctor! Chiral reaction decreasing. Hurry! Vitals dropping. We're running out of time.
Oh, I failed the operation even though I got it. Alright, try this again. I see how to do it, I just screwed it up.
I won't give up.
Operation.
There isn't much time. Doctor. Proceed as normal.
Yep, I'm ready. Let's
We've
do this.
located the guilt.
Come on, combine.
Doctor!
I know.
Doctor! Chiral reaction decreasing. Chiral reaction decreasing. Hurry! Vitals drop amazing.
There we go. Got that one done.
Good news.
You did it, Doctor. Amy's going to be okay. It's a miracle.
We can do this.
Alright, we can do this.
Vitals dropping. Doctor! Vitals dropping.
Oh, she died on the. Oh, this is getting tough now. Oof. You gotta really start controlling your operation stuff. You gotta really watch what you're doing now. Crazy. Crazy, crazy. We got this though.
I won't give up.
There isn't much time.
I know there isn't much time, I know.
Doctor. Proceed as normal. We've located the guild. Doctor! Chiral reaction decreasing. Chiral reaction decreasing. Doctor! Hurry! Amazing! Vitals dropping.
Vitals are dropping, I know. Alright, time to close up.
Good news!
Alright.
We can do this.
There we go. We can do this.
Doctor! The chiral reaction is dropping. Vitals dropping. Vitals dropping. Chiral reaction is negative.
I think we're getting there. Alright, time to close up. You're a real doctor, I respect you. Thank you. I try. I really do. No, this is actually a really short game. Depends on how... It might take a little while. It depends on how much it ramps up later on. There is only six... there's only 6 episodes. With like 10 mini chapters, but not every one of them is a... not every one of them is an operation. Unless I have to do episode X. Oh. Rookie Dr. C. See, I'm back in my C's. Derek. It's your decision, man. If you want to turn me in, do it. I'll resign if that's what it takes. I don't care. I'm just glad Amy's okay. Thanks, Derek. I want you to do me a favor. Huh? Re-edit that thesis you wrote and offer it to Candace. You're feeling okay, dude? Tyler, you've always been a good writing of detailed papers. Despite how you use the research, your thesis was no exception. Eliminating the pain and suffering facing death, doctors and patients can both benefit from your research. Find a way to use the information to save people's lives. That's all I ask. No problem. You got it, bro. Oh, there you are. Amy's gonna be awake soon. Let's go check on her then. Why do you think Big Brother? What do you think, Big Brother? Hey, don't call me that. This one's just a story beat. Alright. It's a lot of reading. Excuse me, sir. You called for me? This operation is amazing. Your focus and concentration is simply unbelievable. Is that the video of our guild procedure the other day? I had my secretary transfer to HDV media card. Watching this is slow motion actually reveals quite a bit. Anyways, have a seat. There's an event I'd like you to attend. Okay. Hey, real fast. I need your signature for this. Victor, we're in the middle of a meeting. Yeah, well, this is only take a sec. The head of the... He's responsible for a lot of organization property. This is that proposal we went over yesterday. There are no changes. Huh? Who's the new guy? This is Derek Stilts from the Hope Hospital. He's hardly new. You need to get out of the laboratory more often. Oh, he's that healing talk guy. I'm Victor from R&D. How is it going? It's going well. Nice to meet you. How's this, Victor? Looks good to me. Okay, later. Sorry, Victor doesn't concern himself with trivial concepts like manners. I apologize for the error. Let's discuss your trip. Our international conference will be held in Angeles Bay this month. Topics will focus on recent issues of medical terrorism. Dr. Steele, I'd like you to attend as a representative of Candace Hewitt. I'd also like you to speak about the strains of guilt you've treated and the steps involved. Can you do that? Well, I haven't really been here that long. I'm sure some of the others could do a better job. We're also showing footage of your operations. I'd prefer that you were the one to explain the procedure step by step. Dr. Myers will be going, so I'll ask her to translate for you as well. Have fun, Derek. Hooray! Once again, the Dr. Styles speaking on behalf of Candace USA. I'm glad it's over. Thanks for your help, Dr. Myers. No problem. I think the video footage really got their attention. You could loosen up a bit out there, though. You're not used to speaking in front of big groups like that, are you? I'm usually too busy just helping patients. Even if I had time for meetings, I'd probably just fall asleep. So yeah, that was my first presentation. Yeah, a lot of doctors that way, but you should just still make time to attend conferences. It's the only way to keep up with the latest technology, you know. Being a doctor is like being a lifelong student. Dr. Kessie used to say the same thing. All doctors are students. Good, old Greg, huh? Now he was one hell of a public speaker. He was confident, threw in some jokes, and never had stage fright. I remember staying up all night helping him make slides. Never mind. That's all in the past though, isn't it? Sounds like you guys were close. It wasn't like that. He was a great guy, so I always did what I could to help out. Really? What's that supposed to mean? Hear that? I think they're starting the next presentation. That concludes the Disease Center workshop. Next, we'll have an update on the fight against medical terrorism. Speaking on this topic is Langston Miller, Director. I received this report a few hours ago. I hope it finds you well. As we all know, medical terrorism poses a serious threat to all the world's citizens. Reports of guilt have doubled in the past year alone. Unfortunately, the motivation behind the epidemic is still unknown, but we have received confirmation that the group responsibility calls themselves Delphi, the Greek oracle. The message we received from them have been very cryptic at best. Their philosophy and demands are still a mystery. Are they related to our other terrorist cells? We do not have an answer. For all we know, they could be nothing more than a fanatical cult. But whoever they are, we know that they are hostile and organized. We believe there are being additional clues hidden in the strange letters that arrived shortly before the guilt operation. We received one of those at Hope Hospital. Medicine has advanced quickly since the advent of genetic engineering, but as guilt has shown us, disease can evolve just as quickly. The ramifications of medical terrorism are grave indeed, and it's going to take our best minds to devise a way to stop it. Though we may finally have somewhere for them to start looking. We received news of an abandoned Delphine research facility. It seems they've entered a small African village, possibly by posing as an MPO. I'm afraid they're using the township to develop guilt. Bastards. The town was destroyed and the facility has been long since abandoned, but I'm for sure there's something there that could lead us to Delphi. I propose the Catus send a research team to Africa. Supplies and manpower will need to be approved by each division. I hope to have everyone's sincere cooperation in this matter. Interesting. How's everyone doing today? Enjoying a little surgery? Because I'm a sea doctor. Just don't let me operate unless you're a crook. Because then you ain't gonna get the best doctor. Alrighty. We're still at the conference? Man, talk about long speeches. Well, a lot over the last year, so I was expecting that. I will not enjoy writing the summary report, though. Huh? The lights? What happened? What's going on here? The shutters are dropping. Is there a fire? You doctors and your temporary cores are worthless. If you would all just die, maybe people could finally stop living unnatural lives. What the hell? What is this thing? Don't touch it. It's a bomb. There's a bomb. A bomb? Come on, Sybil. We have to get out of here. Damn it, there's no way out. We're gonna die. Somebody help us. Sounds like it's over here. Follow me, Dr. Still. What? But that's where the bomb is. Exactly. What are you gonna do? We have to run. There's nowhere to go, but I told you to follow me. If you're going to die anyways, what's the difference does this make? Be a man. Yes, ma'am. You're going to dismantle the bomb. I'll assist you. What? I can't do that. So you'd rather do nothing? Are you going to sit here and cry for help like everyone else? Screw that. If this doesn't work, at least we can say we tried. I'm ready. Give us some room. Set up the barricade with the desks and tables. Everyone take cover. Okay, Dr. Stills, there's no turning back now. Alright, it's a bomb. Blindly cutting would be extremely bad. Cross your fingers and listen to Dr. Myers. I think everyone's clear. Enough. Okay, you'll need to follow my instructions carefully. Got it? Aren't you scared? Of course. Why should a doctor be afraid? I'm sure you've been in worse situations than this. We hold patients' lives in the palms of our hands, you know. One mistake and you have to watch them die. What could be more frightening than that? I guess you're really brave, Dr. Myers. They don't call me the Iron Vixen for nothing. That's what Tyler said. He comes up with some weird nicknames. Actually, they started back during my days on the police force. I was in the crime lab, you know. Even though I was just a novice investigator, I was still stronger than all the guys. So you were really a police officer? That's right, and I dated a guy on the bomb squad, so trust me on this one.
Let's begin
Okay
dismantling.
then, let's begin dismantling the bomb.
Ready to go?
Now we can afford time to waste it. Let's do this. I can tell you it's without opening the lid. Looks like there are 4 screws holding the lid in place. Your scalpel should do the trick.
Right or left?
Tricky. They use a counter thread screws that unscrew clockwise. Keep that in mind. Okay. Oh, I can't even unscrew a screw. So we have a panel with blinking lights. Screws that won't turn. Okay. These screws are all different. They unscrew in different directions. If they're try turning in the wrong direction, one of these lights will turn on. I'm guessing that once all the lights are activated, boom, we're history. Essentially, the panel is telling us how many misses we're allowed. It looks like we only have room for 2 more mistakes. I assume they built this to frighten us, so we'd be able to defuse the bomb. We should prepare for the worst, but let's concentrate on getting through this.
Hold on. What's this?
I don't get it. I want to miss again. I don't understand the clue. Not a bomb diffuser. I'm a doctor.
That's 1.
Boom. Told you I'm not. Told you I'm not a bomb diffuser.
Let's begin dismantling the bomb.
Ready to go? Right or left? That's 1. Two down. We only have 1 more. Derek?
Alright. We know it goes this way.
Now for the next one.
Lift the cover, be careful. Okay.
Derek?
Huh? Can you recognize it? Listen to me, Doctor. The hexagon panels can be destroyed with your surgical laser, but you cannot touch the panels that are lit up. But all the panels are lit up, aren't they? If we can stabilize the voltage at a certain level, it should be more clear to you. Luckily, I think I can do that just now. I'm impressed, Barbara. You must have learned a lot on the force. Let's just say criminal investigation have strange lunchroom conversations. This is it. The voltage regulation device. By changing the plugs, you can adjust the voltage. I suggest using the forceps. No.
Pull it toward yourself. Don't let go of it. Press it in. Don't do that.
Don't let the plug until it's pushed all the way out.
Good work.
Well, I was trying to pull it back. Well, it won't pull back. Look. Oh my god. The controls are not working. See? I'm trying to pull back. Oh wow, you gotta watch where you grab them. See, it's not pulling out. Why? What's going on? I'm gonna lose the bomb again. This thing ain't pulling out.
There isn't much time.
I'm trying, but it won't pull. See, it won't pull. It won't pull. Try a different controller. See if we can get it to pull in. This is getting irritating. I was using one of the newer controllers. Maybe if I swap to an older controller. Maybe if I move my sensor bar, it might help too.
Let's begin dismantling the bomb.
Yep, dismantling.
Ready to go? Right or left? That's one.
You're turning the wrong way.
Two down.
Something is. Everything's in the way or something with the sensor bar.
You
Now
only
it's
have
not
one
working
more.
like it wanted to.
Now for the next one.
Okay. We know about this part. We're stuck at this part.
Pull it toward yourself.
Look, I'm pulling towards myself. Towards myself. See?
Don't let go of it. Press it in.
Oh, it's...
Good work.
See, I'm pulling towards myself and it's just not working.
You're doing fine.
Hey, I did it. I think I just need to move away from the sensor. I think I'm just too close to the TV for this game.
Okay, let's get it done. Good work. Don't do that. You're doing fine.
Am I really doing fine? Bro, blew the bomb up. Mm. Oh, can we just defuse this bomb already?
Let's begin dismantling the bomb.
Ready to go?
I knew it. Knew it! Because it was going the wrong way. Come on, screw.
Hold on.
Nope, I went the wrong way again? Is it the other way on this one?
That's one.
Okay, it is. Okay.
2 down. We only have one more. Now for the next one.
There we go. Now we got that done.
Derek,
I'm gonna do the next part.
pull it toward yourself. Don't let go of it.
I'm trying to get it to pull. It won't move.
Press it in. Good work.
Row, row. It's because I'm at a weird angle with the TV. That's what it was. Alright. I figured it out. Awesome.
Let's get it done.
See if we can actually not blow the bomb up this time.
Good work. Don't do that.
Fucking hit the target. Oh, the sensors. Alright, I'm moving this back because we figured it out. We figured it out. Awesome. Trying to defuse a bomb's worse than surgery.
Let's begin dismantling the bomb.
Ready to go? Right or left?
What the heck?
That's one. 2 down. We only have one more. Now for the next one.
Alright, now we get to the board.
Derek,
Yeah, we know. Keep coming, keep it coming, keep it coming. So much dialogue before you show your next try.
pull it toward yourself. Don't let go of it. Press it in.
I want it out.
Good work.
I wanted it out. grab it at the right angle. These things are so picky. Trying to find the right angle. Come on, you're losing so much time because it just won't freaking work like it was supposed to. Thank you for coming out.
Okay, let's get it done. Good work. Don't do that. You're doing fine.
Let's
You
begin to
send
speak like
me
above.
right round, right round, right round. Let's go. Come on.
Ready to go?
Yes, I'm ready to go.
Right or left? That's one. Two down. We only have one more. Now for the next
There
one.
we go. Alright.
Derek,
Yep. I already know. Come on. We gotta get this. We're gonna defuse this bomb.
pull it toward yourself. Don't let go of it.
It's coming towards me. Come on. These things are so freaking stupid and finicky. I don't know when they want to move.
Press it in. Good work. You're doing fine.
There we go.
Okay, let's get it done. Good work. Don't do that.
Alright, we officially put our helmet on.
Let's begin dismantling the bomb.
We cannot disable a bomb. Of all things, a bomb.
Right or left? That's one. Two down. We only have one more. Now for the next one. Derek,
Alright, come on.
pull it toward yourself.
Yeah, I'm pulling towards myself, and it just
Go
doesn't
of it.
register half the time. This thing is so finicky. Come on, pull a little hole already. See, it started to.
Press
and
it
then
in.
just went.
Good work.
So we lose so much time here because how finicky these things are. We're gonna lose so much time. So we're gonna lose lots and lots of time on this part. Because it doesn't freaking pull when it says pull. It says grab it and pull it towards you, and it doesn't do it. It's ridiculous. Hey, look, I'm pulling back towards me. Back towards me. You guys can't even see me. 'Cause I'm not in the camera. Come on, dude. Come on. Pull out. It tells me to move it back. This thing expects you to be like 20 feet away from the screen or something.
Okay, let's get it done.
There.
Good work. Don't do that.
Yeah, that was my stupid. No, I'm stuck on a bomb, Turtle. I'm stuck on defusing a bomb. Yeah, a bomb.
Let's
I've
begin
officially
to
put
make
a
the
struggle. Yeah, I know, right? Way to bomb that mission.
Ready to go?
Can't believe it. I got stuck on a bomb.
Right or left? Derek?
Oh shoot, that's right. That's the wrong way. I gotta go through all this dialogue again.
That's one. Two down. We only have one more.
Go the other way before you
Now
knock
for the
another
next
notch out. Thank you.
Derek? Pull it toward yourself. Don't
Yep,
let
here
go
we
of
go
it.
again. Trying to find the angle again.
Press it in. Good work.
Come on. Find the angle. Pull that thing out. Come on. Come on, find the angle. Come on, find that ankle. See, it started to pull. I can't let go. Come on, find the angle. Come on. Thank you.
You're doing fine. Okay, let's get it done.
Yeah, accuracy is key on this part, I know. I don't have any, obviously. This is where I keep failing.
Fine.
As soon as I pressed the button, it blinked over. As soon as I did. Now I gotta go through all those pegs again. Oh, I hate them pegs. Those pegs weren't so bad, I wouldn't be so frustrated. The peg, because the accuracy thing's not the biggest issue, it's the pegs. Gotta keep doing.
Ready to go.
Yeah, I should have went for a different one when it's, because they were blinking between them.
Right or left? That's one.
I about screwed that one up.
2 down. We only have one more. Now for the next
There
one.
we go. Now the hardest part.
Derek,
Just bomb thing so far.
pull it toward yourself. Don't let go of it.
Oh, thanks for the
Press
hose.
it in.
It freaked me out there for a minute. I didn't know what happened. Appreciate the host there, Turtle. Alright, time to find this angle. Oh my god, these things. Come on, find the angle. Where you want it. Solely pulled. Waste like 2-3 minutes right here on this part, I swear. Trying to find an angle. Yeah, just keep wasting time. Breathe. Just let the time expire. And breathe. It's getting ridiculous. Broken motion controls. See, it started moving. Which way was I holding the remote? Yeah, well, there isn't much time. I know. Because you won't listen to me. You tell me to pull back, and I'm pulling back, and it's not moving.
Let's begin dismantling the bomb.
Yep, let's try to disassemble this bomb again.
Ready to go? Right or left? Derek?
Nope, I went the wrong way on that one. That's my fault. Now I gotta listen to all this dialogue.
That's 1. 2 down. We only have 1 more. Now for the next one. Derek?
Yep, come on. Let's get through all this and see if we can't get the right angles. Alright.
Pull it toward yourself.
No, already can't get the first one out.
Don't let
It
go
says
of
grab a plug and pull it towards yourself. Watch, pulling. It's like you gotta be 20 years back to get this fucking mechanic to work. Nope, can't get it back there now. Oh my god, ridiculous. Donkulous. Fucking pegs are. Might as well restart again. I've wasted too much time. Trying to pull pegs out. Doubt it's gonna, because this is probably a motion game. It says don't let go until the plug is pulled all the way out. Well, it's kind of hard to do that when the thing hardly ever pulls out. Come on.
Press it in.
No. I need you up top.
Good work.
stuck. I'm literally stuck on it because the motion controls ain't working.
Let's begin dismantling the bomb.
Why is my timer got reset?
Ready to go?
I'll just restart it. I know how long I've been on this game.
Right or left?
No.
That's one. Two down. We only have one more. Now for the next one.
Yep, now the hardest part of the whole dang bomb
Derek?
fuser. My hand is cramping up too.
Pull it to yourself.
See, look, I'm pulling it towards myself. It just
Don't let
it
go
don't
of
do
it.
nothing. Yeah, I'm stuck on the pegs now. I can't even get to the other part. They're stupid. The motion controls broke on here. For this part. It's really broken. Controls, I'm fighting the controls so hard. It ain't the game. It ain't really the difficulty of the game. At this point. Right here, it's just motion controls. Sensor all the way down to the fucking desk. I knocked the sensor bar down when I bumped the table. Yeah, my rage is real right now because really irritates me when controls are broke. I'm trying to practice this part, sorry. Something I'm doing wrong. I gotta be doing something wrong. got it out. I'm getting there. Yeah, I was gotta be doing something wrong. That one came out no problem this time. Oh, did I knock the whole... Oh, I knocked the whole picture down. Okay. When I was back there trying to get the sensor bar. Must have knocked the capture card. It should be coming up on my screen. There it goes. Back. There we go. Breathe. Yeah, I'm ready for like the 10 seconds I get.
Good work.
Give me a little practice. I didn't even realize that. I didn't realize I knocked out the capture. I looked over. Maybe I got the method down now with these pegs. I don't know. These pegs are what's really set my rage going. Back to slapping games, yep. Alright. Time to try to defuse this bomb for the 20th time. For all this thing die low.
Let's begin dismantling the bomb.
Ready to go? Right or left? Derek?
Yeah, I'm only on still on episode 3, so I still gotta wait. But I'll complete it tomorrow during the day. I already know it.
2 down.
It'll be slapped tomorrow, and then tomorrow night when we come back, we'll be
You
starting
only have
Marvel.
1 more. Now for the next one. Derek?
Let's see if I learned anything last time on these.
Pull it toward yourself.
Nope. See, it still ain't working.
Don't let go of it.
Nope, it's moving. I think it's moving. Nope, it's not moving. It looked like it was moving. I have 30 episodes. What do you mean 30 episodes in this game? I think there's 30 stages left. like, whatever. Try the other one. Oh, okay. Maybe tomorrow night we'll still be on it because I'm slower than molasses, and even though I'm on easy mode. This. The motion controls is what's breaking it right now for me. I don't understand what I'm doing wrong. It says pinch it, pull towards you. That's what I'm doing. I don't understand what you mean pull towards me. Look, it's towards me.
Press it in. Good work.
Thank you, turtle.
You're doing fine.
To me, towards me is tilting and not pulling back.
Okay, let's get it done.
I guess I just common sense ain't my cup of tea here. So now we got that part solved. Now we just gotta slow down on this part and get this solved.
You're doing fine. Don't do that.
I was up at the top, silly. I forget that they want you to hold the controller like a remote. Towards you would be pulling back. And pulling back would be like that. Duh. I have a problem with tilting.
The bomb.
Now we'll be able to just try to practice that one area.
Right or left? That's one. Two down. We only have one more. Now for the next one. Derek? Pull it toward yourself. Press it in. Good work. You're doing fine.
Now you explained it to me, I got it.
Okay, let's get it done. Good work.
Learning curve for me. Remote. Press. Oh, the minus on the Wii remote to save you time. Okay. Cool.
You're doing fine.
Thank you. Must be doing research in the background.
Almost there. Don't do that.
It changed. It literally just changed. Right as I fired. Alright.
Let's begin dismantling the bomb.
Yeah, I did. I save a lot of time.
Ready to go? Right or left, Derek?
Oh, that might help if I turn it the right way, Doobie.
That's one. Two down. We only have one more. Now for the next one. Derek? Pull it toward yourself. Don't let go of it. Press it in. Good work. You're doing fine.
There we go. Time to do the laser part.
Okay, let's get it done. Good work.
All about accuracy, you say.
Don't do that. You're doing fine.
Alright, one more time. Up, over, down, up. Nope. I'm done. Done with that.
Almost there.
Oh, I didn't mean to press the button.
Let's begin dismantling the bomb.
Ready to go? Right or left?
I was trying to slow it down. That's what I was trying to do there, but I can't make a star to save my life.
That's one. Two down. We only have one more. Now for the next one. Derek? Pull it toward yourself. Press it in. Good work. of it. You're doing fine.
Struggle bus is
Get it
real. It's okay though. I'm okay with it. Breathe.
Good work.
Don't just fire. Watch it.
You're doing fine. Don't do that. Almost there, Derek.
I need to slow it down when I get to that point. That's what I need to do. I need to try to make that star.
Let's begin dismantling the bomb.
Patience is key.
Ready to go? Right or left? Derek?
See, I hit the wrong one again.
That's one.
Here he comes with all the pro tips.
Two down.
Which is helping.
We only have one more. Now for the next one. Derek? Pull it toward yourself. Press it in. Good work. Don't let go of
Guess
it.
I need to grab it lower.
You're doing fine. Okay, let's get it done. Good work. You're doing fine. Don't do that.
See, I didn't know that was one of those switches. That was clearly right on a white one. I don't know. I guess it was just off by a hair. Then
Let's begin dismantling the bomb.
wasn't trying to rush at that time. I know that one I hit. I didn't realize was one of those that you had to really watch.
Right or left? That's one. Two down. one more. Now for the next one.
There we go.
Derek, pull it toward yourself. Press it in. Good work. Don't let go of it. You're doing fine.
We're doing fine.
Okay, let's get it done. Good work. You're doing fine. Almost there. Don't do that.
We did it. Here comes the regulation core. Okay, this is basically the center of the bomb. If we deactivate this, the bomb is useless. Use your laser to destroy it.
Hurry!
Aim for the regulation core, nothing else. We're almost there. We got it. Okay, I'm gonna have to draw this. I know what I need to do there. I definitely need to draw this star there.
Let's begin dismantling the bomb.
I don't have a choice. I gotta try to draw a star.
Ready to go? Right or left? That's one. Two down. We only have one more. Now for the next one. Derek? Pull it toward yourself.
Bam!
Don't let go of it. Press it in. Good work. You're doing fine.
There we go. rushed it. I deserved it. I deserve that. I deserve that. I rushed it. Didn't want to wait for the cycle. Didn't want to wait for that cycle.
Let's begin dismantling the bomb.
Ready to go? Right or left? Derek?
Oh, that's right. It's the other way. Brain always gets confused.
That's 1. 2 down. We only have 1 more. Now for the next
There
one.
we go.
Derek? Pull it toward yourself. Press it in. Good work. You're doing fine. Okay, let's get it done. Good work. You're doing fine. Almost there, Derek. Don't do that. There isn't much time. Hurry!
Hang in there.
Phew. Should be safe now. Glad that's over. Talk about your bad patience, huh? Success. Alright. I'm dizzy. I can't feel my hands. At least we're alive, right? Better than dying any day. Of course, I knew you'd be fine. It was just a bomb, no big deal. Iron Vicks, huh? That nickname with Hereverse is starting to make sense. The lights are coming back on. We should tell the others it's okay. We stopped the bomb, everyone. It's all clear now. Thank God. I thought we were going to die. We're alive. Great job there, Stills. You definitely learned from Greg. Eh, same to you, Dr. Myers. You're pretty tough. Woo! We're alive! Let's hear it for Dr. Stills! I believe we found the perfect candidate for the African mission. Footfalls of Terror. Alright, I gotta use Tinkle real fast. You wanna go lay with Christian? Riley. Yes, let's start this episode. Ooh. We received a letter of thanks from the conference directors. I was worried when I heard about the attack. I'm glad you both made it out safely. It's all thanks to Dr. Myers. Haha, she's definitely the toughest woman in medicine today. You should ask her about some of her adventures on the police force sometime. Chief, Derek's going to take you seriously. He'd have good reason to. Oh, that's right. There was one other message I received. Dr. Stills International has requested your presence as part of the research team headed to the Delphida facility in Africa. They asked me? That seems like a mistake. Don't be modest. We all seen what you are capable of. You have experience treating guilt, and you defused a bomb. Langston Miller, director of Kindness Europe, was very impressed. Yeah, but I've never left the country before. Well, you don't have much choice. I already accepted you on your behalf. Give it up, Styles. Once Sydney decides on something, there's no arguing with him. Looks like you're going to Africa. I didn't realize he could be that. He's so stubborn. I guess he's always been difficult. That's what Greg told me anyway. I remember him talking about the arguments they'd get into when they were kids. The reason Sydney went to school overseas was supposedly because everyone told him not to. Dr. Kessica is stubborn sometimes, but never anything like that. At any rate, I'll have fun in Africa. As long as your partner's reliable, I know you will be fine. Partner? International Flight 326, destination Africa. Rulers far away. I mean, 3 transfers in 33 hours of total travel time. Wow. At least we're used to it. I've never been to Mexico and I don't like flying. Remember to drink plenty of fluids and periodically stretch your legs. It wouldn't look very good for a doctor to get sent to a hospital for blood clots. It'll be hot in Africa too. I try not to get heat stroke. I hope getting vaccinated for the epidemic disease was no. Attention please. Is there a doctor on the plane? I repeat, are there any doctors on the flight? Either of our passengers is sick, so we don't know how to treat them. If you have any medical training, please notify the flight attendant. Doctor? So much for sleeping on the plane. Epedema of the lung is worse than causing respiratory failure. Fluid must be drained from the lungs to secure the respiratory tract. It looks like respiratory failure. From what his wife explained, he'd be suffering from epidemia of the lungs. He was prescribed medication which established the condition. They were given permission to return to home, but stress from traveling may have aggravated his symptoms. I'd recommend a Labacare to drain the fluid. We're going to perform surgery in mid-flight. The captain has allowed us to use of the crew's cabin. Sterilized gowns and operation tools have been provided as well. I really don't have a choice. Once we land, we can receive more permanent treatment. But for now, we have one objective: drain perineal fluid from the inside of the patient's lung. Use ultrasound to find where the fluid has accumulated and drain it. Understood. Let's hurry.
Starting the operation.
Unfortunately, Doctor, there's storm up ahead. They're going to try to avoid turbulence much as possible, but this is as far from ideal operating environment. Try not to let the shaking of the plane distract you. Respiratory failure is serious. We need to finish this quickly. Try using the ultrasound to locate the ideal draining area.
Doctor,
There's a lot more fluid in here than there should be. Drain it immediately.
treatment complete.
We drained it all. It's turbulence. I hope it settles down soon. Eek.
You have to be careful.
It's stabilized. We should probably stop operating when the turbulence picks up. Especially if you're using a scalpel. That would be terrible.
Doctor! Vitals dropping. Doctor!
Oh, we about lost our patient due to that turbulence. Alright, where's some more fluid? Alright, more turbulence. Interesting.
Almost done. Only half complete. I need to speed this shit stuff up. Not much time left. Vitals dropping. Doctor!
Yeah. I think I'll be redoing this one. "30 seconds and turbulence just hit." Yeah, I'll be redoing this. Yep, told you. Yep. Gotta rush through it. And with this turbulence, it was just... Gotta go faster. Got to go faster.
Starting the operation.
Yeah, gotta go faster.
Let's begin. Doctor. Treatment complete. Careful.
Here comes the turbulence.
You have to be careful.
I gotta get at least 2 in each shake. Impossible to get through this.
Almost done.
Oh, I couldn't find a third. I got 3 in that one. That was pretty cool. It's getting ready to start shaking now. Find one. Just to be on the safe side. Of course, I couldn't find the third. Can't find nothing. There it is.
What a relief.
Patient's breathing has stabilized. Yes. Patient's stabilizing. Yes. Deep breath. I guess we did it. Oh, they're applauding. Don't let it go to your head, Dr. Styles. Ooh, I got an A. A. That was cool. I think he'll be okay. I contacted the hospital near Roboro. We can take him there once we land. Doctors really are on call 24/7, aren't they? Hey. Hey, it's Bear Lover. How you doing? Remains of Rose and Blah. We're finally here. The sky is so clear. Breathe in that air. Yeah, I know, right? 5 kids. Well, 4 are biologically mine, 1's not. But still, it's 5 kids. And it's deserted. I think we're looking at the results of a guilt outbreak. Ooh, I wish we weren't here so far away from home. Hey, don't talk like that. Over here. Who's that? It's nice to finally meet you, Dr. Styles. Oh, Director Miller, sir. This is Langston Miller from Candace Scraw. Right, he's the one who assigned us to this mission. I was getting a little worried you were a little late. You see, you're one of our coordinates to 6, and we don't know exactly where the research lab is. There's been a lot to worry about. Sir, I have an update. We searched sectors B2 through 4, but could not locate the target. In that case, expand your search into the C areas as well. Yes, sir. The jungle makes a bird-eye search impossible. We tried to narrow it down back home, but we still have a lot of ground to cover. It must be frustrating. I have a bad feeling about this. You may as well join the search. Report back if you manage to find anything. Here's a map of the area. We sent teams out here and here. This game is very impressive. I'm enjoying it. It's got a very deep story. What kind of map is this? I can't make out any landmarks or anything. Yeah, it's just like a visual short novel deal. With surgeries in between, you kind of just kind of thing. What kind of map is that? Well, let's get started, I guess. Yeah, I kind of would agree with it. It's kind of a visual novel sort of thing, because 6 hours later. Are you alright, miss? I'm glad we can drive, but this Jeep sure is a bumpy ride. Well, there ain't any roads in this area, but at least we're not out in the jungle. It's been a long time, so let's head back to the camp for a breather. I didn't mean... Stop the Jeep. There's someone in that house. It's a little kid. I thought they said this area was abandoned. 1 hour after that. The boys answered to Reuben, we think. Nice to meet you, Reuben. What was he doing there? We think he used to live. His family actually lives not far from here. Shouldn't we take him home? Perhaps, but the boy seems to know the location of the research lab. Apparently his brother worked there, and Reuben got to tag along once in a while, or twice. It's more of a lead than we found here thus far. Don't you agree? It's good to play in City. Thank you, Reuben. Oh, here's the old facility. As we thought, it was completely vacant. What exactly are we looking for? Let me take samples from the walls and floor just in case. Thank you, young lady. We'll need to undergo decontamination procedures after this, but hopefully we'll find someone to make it worthwhile. There is no place for a child, I'm afraid. Could you wait outside? There's a good lad. Cross your fingers. Yes. Pandora's box. We're getting ready to go do some surgery. Alright. After all that, we still have learned anything about Delphia? And listen to Disco. African guilt victims are being transferred to Cadiz, Europe, right? Hopefully that will lead to something. Yeah, but this was all so tiring. Dr. Miller is late. I wonder who he is speaking with on the radio. Dr. Stiles? What is it? The boy Reuben has been affected by guilt. What? How? Extreme care is necessary during treatment. The boy's clinical results just came back. He tested positive for guilt. Spectral analysis indicates this is a different strand. Unknown guilt. We found an abnormality in his pancreas, but that's all. His vitals are dropping quickly. If we tried to reach the hospital, he would probably die on the way. I think we should open him up and do what we can, but it's your call, Dr. Stiles. I understand. We can't just stand here and watch him die.
Begin.
Some of us. Surgery. Let's begin. By not cutting a straight line. What the heck? A membrane. And these things look like thorns. What could they have known about? What is it, Dr. Miller? Stiles, I think the membrane is responsible for the disease. Any organ covered by that membrane will be slowly touching them.
Wait, Doctor!
Hold on, you won't be able to detach it that way. Don't you see the thorns? They're fastened the membrane to this organ. Anyway, try pulling thorns out with your forceps. Okay. Come on. Okay, it's out. Now try removing thorns from all 3 corners. Hey! Thank you. Remember, it's spreading. You can't just grab it at it. I see. Those thorns are causing the guilt to spread. A while ago, our country tried using similar toxins like shards would vibrate at high frequencies. Hardened membrane exactly like this one. A strain of guilt seems to be molded after our treatment.
What?
Come on. I hate that you gotta lift them so high. I'm gonna kill this patient. I can't lift these up.
Vitals dropping.
Alright, we'll give him a couple shots. And one more. Just for good measure.
Are you okay?
Jesus.
What about that one?
Yeah, I get there. I know what I gotta do now. Drain it. What the heck? The pattern that I'm not seeing. I don't want to use my brain. I want you.
Vitals dropping.
See, they all came back because I couldn't get them fast enough. I don't want to use my brain to figure out a pattern. Guess I'm going to. I can't pick these fast enough.
Not much time left.
Pick them up. Come on. Oh my god.
We're running out of time.
Retry. Cause I gotta figure out the pattern here. Oh man. Gotta figure out a pattern.
Let's begin.
Alright, try this again.
Let's begin.
I need the scalpel, that's what I need. Can't even cut it open. There we go. Yeah, we know. We know about this new guild.
Wait, Doctor!
Yes.
What? What is that?
Oh, I wasn't paying attention. This one grew down here.
Think again.
How? What grew? Trying to keep everything separated.
What about that one? Vitals dropping.
Oh my god, this game. Nobody said it was going to be puzzles. See, this just revived everything because you couldn't lift up and over. I was there. I had part of it solved. I just couldn't get it lifted.
Vitals dropping.
Yeah, let him die. This puzzle is just ridiculous. Alright.
Vitals dropping.
I don't get it. He's gonna die because he can't lift up over. Over. told you he was gonna die because he couldn't lift up and over, dude. You gotta lift up and over. Alright, try this again.
Let's begin.
Alright.
Wait, Doctor!
Yeah.
What is that?
See, as soon as I took that out.
I think I get it. What about that one?
You know what? Okay, you gotta breathe when you're trying to do this.
Are you okay?
Come on, draw it. Does that happen?
Hang in there.
Thank you.
Vitals dropping.
That was pointless to do because you dude can't freaking pick it up. I hate the control. Everything's normal again. That was pointless because I couldn't lift nothing. Morning, Bryce. How you doing?
Vitals dropping.
Yeah, I know your vitals are dropping so hard.
Vitals dropping.
Yep, he's dead. I was kind of intrigued with that fairy tale game, honestly. It was kind of interesting. Yeah, I know. Yes, let's repeat. Thank you. So feel a little bit more refreshed. Ready to go. Let's see if I can solve this now. This is kind of tricky. I gotta figure out how to solve this.
Let's begin.
Let's begin. Cool.
Oh my god! Wait, Doctor! What is that? What? Think again. What about that one?
Jeez, I really need to solve this puzzle. No! No, it grew back.
Vitals dropping.
I want to restart this. It's got out of hand. It's too many.
Let's begin.
They got way out of hand. Okay.
Oh my god! Wait, Doctor! What is that? What? Think again.
Alright.
What about that one?
I got out of hand again. It's getting out of hand. I'm getting it to a good start. Just not getting very good at keeping it at a good start. I lose control. I gotta watch the upper part while I'm working on the lower part. That's right. Cool.
Wait, Doctor! What is that?
Nope, that wasn't the right move.
Think again. What about that one?
No, I already screwed this up. I picked the wrong one to go with first. Oh, why do they gotta make me use my brain? My brain ain't working at this hour.
Let's begin.
Alright. Ah! That was bad cut. Yeah, I'll give that. That was a bad cut.
Oh my god! Wait, Doctor! What is that? What?
Gotta kill that cell.
We can get it. Are you okay?
I want this one.
What about that one?
Getting out of hand. Yeah, because it's just it's out of hand. Gotta really pay attention.
Let's begin.
Gotta really think about this. There we go, cool.
Oh my god! Wait, Doctor!
We want to get rid of that one first. So this will stop growing. We need to get rid of that. Get rid of that.
What?
You know what? Let's try this. Nope. Nope.
Are you
Nope.
okay?
That's nowhere near. Try it one more time. Try it one more time. No. Come on, give me my star.
Vitals dropping.
Yeah, I know the vitals are dropping. I'm trying to make a star right now. I can't make a star to save my life. I don't get it. Oh no. I don't get what I'm doing wrong here. You know what? I don't get it. I know I got this. I just gotta figure it out.
Let's begin.
Let's begin.
Figure this out.
Oh my god!
I know the first move is gonna be this one. Is to get rid of this plaque.
What is that?
From there, I don't know where to go. I'm trying to think of my move. I go from here. Trying to think about where to. This way it ain't moving. Because I know where everything's at. Trying to think of what move I want to make next. Moves. We need to move. Think about this bubble. Think. Any, meeny, miny, mo.
What? No! I almost had it! Solved! And they had to regrow so fast. Doctor,
So freaking fast! The regrow! Pick the wrong one and they regrow so fast.
are you okay?
I just want to at least try to solve this one by the end of the night.
Vitals dropping. Not much time left. We're running out of time.
I know, we're running out of time.
What about that one?
I keep we're growing at some random rate. I might as well restart. No way to get out of it with 6 seconds. I just got cornered.
Let's begin.
Let's begin.
All right.
Wait, Doctor!
All right. I'm waiting. I'm waiting. I know I'm picking this one. I'm picking this one. I'm picking this one. And I know we picked this.
What?
Then it's from here is where I'm trying to remember what to grab. Trying to remember where. Trying to think about where to go from here. See? Almost had it. I regrew so much. I get it down to that last little panel.
What about that one?
I don't know. I don't know either. Breathe. Getting on my nerves, man. Yeah, I know, I got it. I just gotta wrap my brain.
Let's begin.
Gotta really think outside the box, I guess. Alright. I'm gonna try something different this time. Because what I've been doing is just not working.
What?
Alright. Now, I just see what I gotta do now. Awesome. I moved a peg. That actually worked really well. I grabbed the peg instead of the pedal. I got you. My method was working there for a minute. Just trying to think of different
Let's begin.
methods. Come on, cut them up. There we go.
Oh my god! Wait, Doctor!
One.
What? Chiral reaction decreasing. What is that? Are you okay?
Come on, lift. Yeah, everything grew. We can't lift.
Vitals drop. Think again.
You can't really look up a guide because if you're too slow.
That one.
I'm already failed. I was
Let's
too
begin.
slow.
Let's begin.
You gotta be fast. I gotta get this cup out of the way or something because it's getting in the way. Yeah, it's touchy. It's it's motion controls.
Oh my god! Wait, Doctor!
See, I like this start, because that way I can just get rid of those, and then I can get rid of this, and this, and slow down the growth by hitting that.
Chiral reaction decreasing.
And then you do that.
What?
Then you do... Maybe.
What is that? Think again.
You know what? I'm just gonna try this one time.
In there.
There we go.
Vitals dropping.
Now if I don't waste the opportunity, though.
What about that one?
I knew it. Stop swinging over.
You okay?
All I want to do is pick it up.
What about that one? Vitals dropping. What about that one? Vitals dropping. Doctor.
Alright, I don't...
Not much time.
Finicky, finicky, finicky. Trying to get through this tonight.
Let's begin.
Try to get at least through this chapter.
Let's begin. Oh my god! Wait, Doctor! reaction decreasing. What?
One.
What is that? Think again.
Yeah.
Let's begin.
Let's begin. These are some tricky puzzles.
Let's begin. Oh my god! Wait, Doctor! Chiral reaction decreasing. What?
Fucking pick it up!
Are you okay?
Yeah. Everything regrew because I couldn't switch fast enough. I'm at the point where I'm about to look up a guide. It isn't gonna really help if you can't do it fast enough, probably.
Let's begin. Oh my god! Wait, Doctor! Chiral reaction decreasing. What? What is that? Think again.
Ah, membranes grew. Thought I had it. There.
What about that one?
Oh, I thought I had it. That time. I was getting so close.
begin.
Let's begin. That's right. We're going to go
Let's
alright.
begin.
Cool.
Oh my god! Wait, Doctor! Chiral reaction decreasing. What? You okay?
Alright.
What is that? Think again.
Ah, so close. I didn't get that thing that evaporated fast enough. And so something regrew. See, I gotta be pulling them faster. That's my problem. Not pulling them fast enough.
Let's begin.
I know it. 'Cause I'm seeing the pattern. Just I'm letting them regrow
Let's begin.
too quick.
Oh my god! Wait, Doctor!
Wait, doctor.
Chiral reaction decreasing. What? What is that? Think again.
See, that one just slowed me down. That one little bitty freaking floater. And then I stuttered a couple times. Ah,
Let's begin.
Let's begin.
we're gonna get there. Give it a few more tries.
Oh my god! Wait, Doctor!
We're seeing a pattern come out now.
Chiral reaction decreasing. What? What is that?
See? That little stutter right there, and now they're gonna regrow everywhere. Little stutter, that little stutter. If I can get the little stutter out of the way, we're good. We're gonna be golden. That one wants to explode. And I always stutter. Focus time, focus time.
Let's begin.
Let's begin.
Let's begin. reaction decreasing. What?
Stuttered again. Yep, stuttered, and that one regrew.
What is that?
Yep.
Think again.
Oh. That one explodes and I get splutter and it just irritating me.
Let's begin.
All right.
Let's begin. Oh my god! Wait, Doctor!
Wait, Doctor.
Chiral reaction decreasing. What? What is that? Think again.
1 second too slow. 1 second.
Let's begin.
Let's begin.
Let's begin.
Go.
Oh my god! Wait, Doctor! Chiral reaction decreasing. What? What is that? Think again.
Why is it just... I should be able to get all those in time. I don't know why I can't get to them in time.
Let's begin.
Let's begin. Oh my god!
Doctor? Doctor, I need your help, Doctor. See? They always regrow. Why? What is going on? Am I not going fast enough? This is kind of crazy. Am I not going fast enough for this thing?
Let's begin.
Alright, let's begin. Yeah, gonna give this 2 more tries. I'm gonna call it. I just think my brain needs to rest.
Wait, Doctor!
I'm back at noon and lose.
Chiral reaction decreasing. What? Are you okay? Proceed as normal.
Trying to understand this game now.
What is that? Doctor!
Oh, are you freaking kidding? I finally understood it and it just regrowed.
Doctor? I think I get it. What about that one?
Oh, I shouldn't have done that. Finally understand how to play this game, and I screwed myself right there. Yeah, I understand how it works now.
Let's begin.
I really understand this. Just gotta really put my brain to it. It just dawned on me. I was like, ooh, duh. Now I just gotta play smart and not rush in my head. I was rushing.
Oh my god! Wait, Doctor! Chiral reaction decreasing. What?
I was a little too slow. Come on, no. Put it down. Too slow. Too slow. Too slow, I already know it because I didn't get this one lifted off. Yeah, way too slow. Just let it go.
Proceed as normal.
Oh! Yes! Oh, let's close up the patient. I missed the story beats, but I don't care. And I don't care, I got a bat on that. My hand's getting shaky and... Impressive, Dr. Styles. It seems that guilt is no match for you. I'd say you're more earned your place in Cardis. Operation successful! Woo! C rank though. Okay, I'll take the C rank. Try not to move, okay, Ruben? You're going to be alright. Your mother's waiting just over there, so you'll be able to see her soon, okay? Director Miller might be able to send him back to England for further treatment. Maybe we should ask him. No, there's a Red Cross outpost in the next town over. I think it's best to keep his treatment local to avoid any complications. A gift for us. But isn't this your book? Can we accept this, Dr. Styles? He wants us to, I think. Huh? Wait, this isn't a book. It's a file folder. Some kind of code, but yeah, read this part. Guilt. His brother must have given it to him. Thank you, Ruben. This is going to save a lot of people. Dr. Stilts. There you are. Director Miller, we have good news. Ruben gave us this. That can wait. We just received an urgent telegram from America. Urgent? Well, I wonder. No way. What's wrong? Dr. Kez from Hope Hospital was just admitted to Kenner's USA. Don't tell me. Dr. Kez has been affected by a new strain of guilt. Dun 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 dun. And that's where I'm calling it. We're on episode 4. We're halfway through the thing, so maybe tomorrow when I'm more wide awake I can fly through this game. Instead of being on a struggle bus. Let's see who's on. I don't think I have anybody on that this late. How's everyone doing though? Oh, this game has been an interesting. It's like a novel with interactive parts. It's definitely intrigued me. I'm surprised I never heard of it. Because I'm really enjoying it. Really have. I guess we'll just go over and say hi to Ice Cream Mikey. That sounds like a plan. See what he's up to today. He looks like he's playing his Xbox 360 with Oblivion. We're gonna pop on over there and say hi. And I will see you all later this afternoon. Sometime later today. I'll talk to y'all later. Hope is under attack. Alright, here we go. It ain't awful. I'm really enjoying this game. Really, really fun. Good, you're back. What? Dr. Castle's condition? Stable for now. He's gotten a lot weaker, though. I don't think he has the strength to survive an operation. Well, go see for yourself. Surgical ward, room 202. Good to see you, Derek. Dr. Castle shouldn't... You shouldn't get up. Don't strain yourself, sir. I should have been suspicious when I couldn't diagnose my own condition. It spread so fast, I didn't think it was guilt. Have they identified the strain? I heard Cindy say it was unidentified type, so be careful. Greg, we've received detailed information on this guild. What? From where? These two just got back from Africa in the Old Delphio Research Facility. The file Ruben gave us. We're analyzing the data. We think it might help us devise a treatment. Don't give up, Greg. I believe in you, and kid. That's why I wanted Derek to join you. Dr. Castle? Keep working hard, Derek. Results will arrive from the lab. They're settled on a theoretical cure. Victor's report says they can create a serum to eliminate the guilt. There's hope then. It's possible, but we don't have enough antigen samples to finish the serum. Antigen samples? While you were in Africa, there was a highly toxic guilt outbreak. My brother was infected while treating one of the victims. In theory, we can extract samples from the untreated guilt patient. As long as the infections haven't progressed to full term, we can just remove the guilt. We've compiled a list of patients with symptoms matching Greg's. Derek, I need you to operate on them in order to obtain the necessary samples. So I'll be traveling to hospitals where the victims are being observed. Yes, exactly. Good luck. Once you have enough antigen, we can engineer the serum. I understand, sir. Derek. Greg is my brother. Please remember that. Of course, Dr. Kessel. Let's go, Angie. Race for the cure. Racing for the cure. Alright. So, gotta turn BB-8 down today. He's getting on my nerves. Hello. Thank you for the follow, Pokey Joe TV. Oh, we're gonna find all the worst ones on the Wii chat on the Wii, aren't we? All right, so I get to pick what I want to do. We'll go way over here. You're excited for this wild ride, huh? I'm gonna send you on over a list. You get a free pick for your follow. We're doing that for the first year. Because we're going by years with the Wii Challenge. I think it's around here. I just contacted the hospital. They'll have the patient ready for us when we arrive. This vehicle is designed as a sterile environment. We can't risk a secondary infection, so we'll have to operate in here. The strain may be spread by physical contact. Wear your protective gear. You strangely want to play some Wii now, huh? Oh, I'm having fun so far. Extract the guilt to proceed antibody symbols for... The patient has been transported and our protective area is now sealed. I'll explain how Dr. Kessel requested that we obtain the samples. These patients have tested positive for guilt. However, the specimens inside them are still in an immature state of development. In fact, the serum should be able to completely... Doctor, first locate the guilt, then use the serum to stop it. After that, place the guilt specimen onto the tray and slice it open. Slice it open? Yes, we need guilt's internal fluids to replicate its antigen. After we drain the guilt, the procedure is complete. We only have one objective in this job. Use the general serum to stop guilt and obtain the fluids. That's all.
Let's begin the operation.
Operation!
Let's begin.
We have two objectives. Remove the guilt from the patient and get a sample. Both required. Alright, let's go open this bad boy up. Oh. There we go. What do you want to play on the Wii? It's an immature guilt cell, just like Dr. Kessel's did. They inject it with a serum. So that would be this serum. The serum was effective, but now it's hidden inside the organ. Try to locate it.
Doctor,
Yeah, I know. I know. I'm trying to get them so I can cut them open. There you go. There we go.
proceed as normal.
Procedure's normal. Alright. Where's this booger at? The guilt has been incapacitated. Move it to the tray. Alright. We're moving it to the tray. Now carefully make an incision down the center of the guilt.
Drain the area.
Now use the drain.
We got it.
Now we need to heal the patient. You have tons of it?
Hang in there.
I will try to do my best. I am a guilt ritter. Ugh, that was bad. Anti-defect this. Oh. Okay. Then we put the bandage on.
Nice work, Dr.
Good.
Suarez.
And here we go. Operation success. And I'm going to get a C for this rating. Because I'm Dr. C. Oh, wow. I'm upgrading to Dr. B. For the list, it's just... You can pick any of the games that are available. As you see on the side, it gives you the code of what's available. Because red's like picked, orange is sports picks, blue is your final games, and gray have already been done. So anything that's white. Super Mario Bros. Okay. Did I do it correctly? I think so. According to what Castle told us, we need 3 types of antigen. There are P, V, and H types. He wants 1 sample of each. I'll send a composition of this sample back to Kenneth. I wonder what type it is. The real MC's here. Look at it. Everybody coming in. There's our answer. It looks like it is the V-type antigen. Let's move on to the next patient. We'll still need the other 2 types. How you doing, Real MC? Yeah, let's go. Alright, so now where do we want to go? We'll go down to the bottom. We'll go to the Civic District. Okay, I'll bring in the patient. Alrighty. Are you ready, Dr. Styles? Obtain a sample quick exactly like you did before. Good luck. Operation.
Let's begin.
Oh. I can't even cut a guy open.
We've located the guild.
Yep, we located the guild. Oh, gotta find him again. There, he's out.
I think it's
God.
working.
Come on, get out there. You gotta get out, dude. Okay, he's defeated. Cool.
Extraction complete.
Extraction complete. Alright. Fill up this bad boy and let's get out of here. Alright. And Digital good.
Dr. Styles.
Alright, I'll put you up there with Splinter Cell. It's gonna be a while on that one because it's probably gonna be around game 17. Operation complete. Good, doctor. Operation success. Have I upgraded to a Dr. B yet? Let's see. Oh, I got an A. No problem. Any word? Let's see, this is V-type. Damn, we already have that type. Let's move on to the next patient. Can't waste any more time. Go to the residential area. Okay, I'll bring in the patient. So here we go again. Are you ready, Dr. Styles? Obtain the example exactly like you did
Let's get
before.
started.
Operation. Thanks for the GG. Yeah, I know, I got an A. I'm upgrading today. I'm wide awake, I guess.
We've located the guild.
There we go. I just gotta find him.
I think it's working.
I think it's working too. done for. We put him on the tray, we cut him up, we suck his blood,
Extraction complete.
we heal the patient, and then we sew it up.
Nice work, Dr. Styles.
Cool. Another operation success. Oh, look at that. Yeah, it's safe to say I'm getting the hang of this game. I am a master surgeon all of a sudden. Angie, how's it look? We did it. This is the P-type antigen. All that's left is the H-type. Let's hurry. Alright, we got two to pick from. We got one to pick from. Well, two. I'm gonna say it's over here. In the suburbs. Okay, I'll bring in the patient. Are you ready, Dr. Styles? Obtain the sample exactly like you did today. Operation.
Let's begin. We've located the guilt.
I ain't gonna get a C this time because I missed. Dude. This comes back to this. Nope, he didn't stay. They ain't my view, dude. He's dead. Put him over here. Let me suck his blood.
Extraction complete.
Heal the patient. And then we close the patient up. You gotta do some surgery on my OG. Oh no, what'd you do to your Xbox?
Nice work, Dr. Styles.
Operation successful. Any word? Let's see. This is the V type. Damn, we already have that type. Let's move on to the next patient. We can't waste any more time. Dang it, I picked the wrong one. I knew I should have went here. For the city whelp. Oh, that'll be alright. Okay, I'll bring in the patient. Blah, blah, blah. We don't need to read all this, because we know exactly what she's going to say.
Let's get started.
Operation.
Let's begin. We've located the guilt.
We rotated the guilt. There you go. Come on, guilt, where you at?
I think it's working.
You think it's working? I think it's working too.
What is that?
What is that? Yeah, this is a new type. Because I wasn't expecting him to do all that funny stuff.
Extraction complete.
Alright, time to close up my patient. Yeah, this is probably like a B or a C. I It's really horrible, this one.
Nice work, Dr. Styles.
Stuff in it. Oh, okay. That's crappy. We don't even have a timer going. I screwed it up yesterday. And we got an A on it. I thought it would be a B because how bad I was doing. How's it look? It's the H type. That's all three, Angie. Let's get back to Kevin. Alright. An A overall. Cool.